brought to you by the Merck Global Health Innovation Fund, Helix VM, FFF Enterprises, one of the nation's largest and distributors in the country, the HTech Collaborative from AARP, and Metadata Solutions, a Dassault Systems company in New York City. Thank you all for joining us today. We are really excited about the program today and have a lot to cover. So we are going to jump right into it. The agenda today includes understanding suicide prevention and how digital health technologies are working to help reduce suicide rates around the world. And we'll jump into the understanding of transformative care and what's happening within value-based care systems with Bethany Hittles from DLA Piper. We'll then go into our chair, Bill Toronto of the Breakthrough Alliance, talking to one of the newest Breakthrough Alliance board members, Olivier Robinschlag, about the Breakthrough Alliance and what's happening there. And we will talk to a very interesting and fast-moving digital health company called Helix VM and its founder, Robert Rodriguez, a New York metro area entrepreneur, successful entrepreneur at that, with past exits and lots of experience going back to Quasha Lipton in the 1990s in healthcare, in digital health. We'll then move into digital health strategies and what's happening with patient engagement solutions. And that'll be a lot of fun talking to Anjana, who's a global chief health information officer. And that's just the first hour. So we're looking forward to a full 3 hours of activities and fun times we'll be taking some polls, etc. So anyway, the next slide, we'll talk about a little bit more. My name is Stan Kichnowski. I'm chair of HITLAB, and I'm excited to be your host today. Please link in with me on LinkedIn, and we'll continue all of our interesting conversations and all of our interesting connections there. So first up, to begin the discussion around value-based care and the importance of suicide prevention in value-based care to improve the overall outcomes in around the country, around the world, is HITLAB's only Riley Fink and Mark Ajevs from Deliberate AI. Mark, Riley, thanks for joining us today.
Thank you for the introduction, Stan. It's my pleasure to begin our symposium by speaking with Mark. He is the founder and CEO of Deliberate AI. So Mark, it is good to see you, and please introduce yourself and Deliberate AI to the audience.
Looks like Mark is having some technical issues. Riley, why don't you introduce yourself, Riley, to the HITLAB community, since you are hosting your first program. Welcome to the Symposium, hosting your first interview. Why don't you introduce yourself a little bit to the HITLAB community and tell people about you?
Absolutely. Again, as Stan mentioned, Riley Fink here. I'm the Innovation Strategy Manager at HITLAB. I've been with HITLAB for a few months now, getting up and running in digital health and consulting. I have a message from Mark here. I am not hearing or seeing you, Mark. Hopefully we can get Mark on here. My background is in physical therapy, so I was a physical therapist prior to joining up with HITLAB here. And so I really am excited about what HITLAB's true, passion is for providing access to healthcare and using technology and really finding digital health solutions for to be brought into the market and promoting greater access to healthcare. So I'm on LinkedIn as well. Please feel free to connect with me, and I'm sure that Mark has much more interesting topics to cover than my background. So hopefully we can get him up and running.
Absolutely. And tell us a little bit more about the HITLAB Advisory Services while waiting for Mark to work out his technical issues. What do you do with HITLAB Advisory Services? I know John Hammett, former global CIO at J&J for 10 years on the executive committee at Johnson & Johnson. He runs that part of the lab. Tell me a little bit about what you do and how you guys help organizations in their digital transformation pathways.
Absolutely. Yeah. HITLAB Advisory Services is really helping to provide excellent solutions in the technology space for digital health solutions. We work with some of the leaders in healthcare, including one of the sponsors of the event, the FFF Enterprise is one of the leading distributors of specialty medications. Mark, I still can't see you. And what we're trying to do is really elevate, provide excellent quality services for companies to provide solutions, really bring innovation within the digital health space, and just again, elevate products to market, capture these awesome companies and their amazing initiatives, and just bring them truly across the finish line in a strategic and just high quality way.
That's fantastic. And you also have a doctorate in physical therapy. Tell everyone a little bit about that.
Yeah, absolutely. I did all of my physical therapy and training on the East Coast. So I'm from outside of DC originally. I went to University of Maryland for my doctorate degree. So shout out to any Terps around here. Physical therapy is a truly great profession. It slides into that, part of the healthcare health journey that a patient can be on. And there are plenty of technology solutions that HITLAB has, partnered with that are relevant for physical therapy, occupational therapy. I met the founder of CEO of Squeg at our most recent summit, and it was really excellent to see some of the innovations and new products and technologies that are helping to capture a lot of that remote patient monitoring, providing real world evidence so that people and my previous profession of physical therapy can really get paid for the high level and high quality work that they do and really bring that valuable care to patients. So excited to have a background in physical therapy that I can use, and certainly a big promoter of healthcare and access to healthcare, and bring that to HITLAB and help generate greater solutions in the market.
Fantastic. And I think a big part of the symposium for everyone who's joining us now and still rolling in is the live Q&A function. So certainly the chat board is open, unlike a lot of other webinars and things that you guys are a part of every day in this new quasi-virtual world. People don't open up the chat box. And so the chat function is open for HITLAB Symposia, which is why we do ask people to add in their LinkedIn or Facebook or some sort of online verification link when they do register for our program, so we can make sure there are real people that are going to come on here and not heckle or hate speech people or whatever. So please do feel free to throw in your LinkedIn links and connect online. I've already gotten a bunch of connections from folks like Sherrod and Michelle and others. So feel free to link in with myself and everyone else that pops in their LinkedIn into the chat bar, so that we can connect. Connection is a big part of innovation. And so it's really important to do that. With that, I'm going to jump out of here, and Mark is going to come back in so we can at least get 5 minutes of interview time to hear about Mark and his transformational company.
Thanks, Stan. Excellent. Well, I'm sure the conversation will definitely elevate from here. Mark, good to see you. Thanks for hopping in. Please introduce yourself and Deliberate AI to the audience.
Yes, I will. And apologies, I'm not sure what's been going on with my connection, but hopefully this will stay okay. So Mark Ashes mentioned, founder, CEO of Deliberate AI. We set up Deliberate AI to really make kind of neuropsychiatric and mental health more objectively measurable. And we're a machine learning company currently really using audiovisual signals from telemedicine platforms as a way of better assessing, measuring, and predicting treatment response for people receiving treatment for mental health care.
That's amazing. Excellent. Considering the challenges with patient self-reporting in mental and psychosocial care, especially due to infrequency and unreliability. How can technologies such as telemedicine be used to analyze symptoms and gather valuable insights? All right, looks like I got at least one question in with Mark.
That's okay. I think,
it was perfect timing.
We at least got to meet Mark. So for the HITLAB audience here today, that was Mark from Deliberate AI. Don't forget to link into Mark as well and connect with him. Again, really nice company. HITLAB is doing work right now in the process of doing a study on Mark's platform, Deliberate AI. As you all know, AI has taken the world by storm, and we're seeing some very interesting elements. We've got probably about 17 different studies up and running right now at the lab, many of them testing AI. Our September Symposium, we will have a major announcement on a major study we did, just wrapped up with 100 participants validating an AI platform. So that's going to be a lot of fun to talk more about that. Also, please remember to join us in the fall. We're very excited to announce the 11th Annual Innovators Summit 2023 at Columbia University the week after Thanksgiving. So for those of you who like New York City, please spend a lot of time in New York City Thanksgiving weekend, and then join us at Columbia University's largest theater, the Lerner Pavilion and Conference Center, and join us for the Innovators Summit. Hundreds of folks from around the world join us. You'll have UN ambassadors, USAID physicians coming in, World Bank executives, AARP will be there, as well as all of your top 10 life science companies, hospital systems, and health plans. And so it's really a nice time to connect with folks like that. And then, of course, a lot of major investors, a lot of angels. We've already seen, just from our past New York City Digital Health Week this past June, an enormous number of transactions, whether it's investments or partnerships or just outright sales, taking place because of that, because of the audience that attends. So hoping that you can join us, use the QR code there and join us today. And with that, again, we have, a nice agenda coming up. The next item, the next talk is going to be from, again, DLA Piper and Bethany Hills-Groyce, who is, again, a longtime friend of the lab and just one of the major thought leaders out there who you want to get to know. And she's also an angel investor. So if you have a startup and you're looking for something, again, reach out to her on LinkedIn. She'll pop her link as well into that. And you can get to know her a little bit more there as well. But with that, I will hand the virtual podium over to Ainsley Bowen and to Bethany Hills-Groyce from DLA Piper. Hey guys, how are you? And thanks for joining us.
Thank you, Stan, and welcome, Bethany. Thank you so much for taking the time to speak with us today. It'd be great if you could start off by giving an introduction and background to the audience.
Sure, absolutely. I am really happy to join your symposium today. I'm a scientist, a public health practitioner, a lawyer, I think as Stan mentioned. I'm an investment advisor. I'm also an angel investor and an LP in a couple of venture capital funds. I grew up in Western New York and have a lot of roots in Buffalo, but I am practicing law and living in New Jersey, working in New York and New Jersey for the past 20 years or so. And I live here in North Jersey, so I come into the city often, but I'm keeping myself busy with 3 kids and a French bulldog. So I'm busy all around. Nice to meet everybody.
Yeah, and again, thank you so much. Bethany was actually on our Women's Health Tech Wednesday yesterday, so super excited to continue that conversation with you. And given your dual roles as a lawyer as well as an investor, how do you see the legal and the financial aspects intersecting with the goal of advancing value-based care in healthcare?
Sure. Well, truthfully, value-based care and outcomes is behind every aspect of what I'm doing. So I'm always looking to contribute to a process that will help a patient with a healthcare problem. We talked a little bit about this yesterday, but I live a very mission-driven life, whether it's what I'm doing in my investing or what I'm doing for my professional career as a lawyer. And then within that, even within that context, I really focus on working with innovators to design their submission strategies, their reimbursement strategies. I lead regulatory and compliance diligence activities for investors, honestly, because if you don't have a solid foundation of funding, then you're not going to get your innovation to the patients. I mean, always the end result of everything that I'm doing is focused towards getting patients to have value-based care. And so I think that this is something that we really need the legal and regulatory system to start thinking this way with a mission-driven focus, because all of us working as individuals, leading with that kind of passion is not necessarily cutting it if the structure itself is not enhancing those types of endpoints.
And absolutely. And on that topic, when you mentioned strategies and innovation, so from an investor standpoint, what strategies or innovations do you believe have the potential to really enhance value-based care models and ultimately drive those positive outcomes for patients, but also at the same time remaining financially sustainable?
Yeah, I've worked extensively with data and statistical models, and I have biostatistic and epidemiology background that I've done ever since my MPH. And all throughout the last 20 years, I've worked with data collection, substantiation of products and development. And really that foundation has prepared me for what is the current AI buzz, right? I mean, AI-driven tools are what I actually would put my money on for achieving the balance between accuracy, efficiency, and finally realizing the promise of value-based care. Actually, one of the first presentations I gave as a baby lawyer back in like 2003 or 2004, 20 years ago, was about value-based care. And so I thought that was kind of interesting to be asked to speak on this topic again, because we are still talking about it. It is a promise that has not yet been realized. And I believe that smarter interventions, AI-informed personalized medicine, cheaper drug and diagnostic development coming through the AI process to make those drugs cheaper at the front end, as opposed to thinking about pricing controls at the back end. All of these things are going to finally revolutionize and be the turning point for value-based care models. I really think we're on the cusp of that happening.
Yeah, and it's so interesting to, like you said, to kind of come full circle with where you started and now talking about it again. And so in terms of like the legal frameworks and supporting the implementation of value-based care, like you mentioned in certain initiatives, what roles do you see that lawyers can really play with facilitating these endeavors?
So I mentioned this earlier, when a legal framework is designed to improve the likelihood of a desirable outcome, like improving a value-based care model, there's two ways that we're trying to accomplish that goal. One is the use of a carrot, right? An incentive, a reward, something being offered to accomplish that goal. And the other is a stick, some kind of penalty, some sort of bad outcome, or something that will make you feel bad, whether it's a financial penalty or you're not allowed to participate in something. And those two pieces, the carrot and the stick, are really different ways to try and incentivize action towards a goal. And when we're designing a legal framework, whether it's the reimbursement, the privacy, the product development, right, we have to be carefully balancing those carrots and the sticks, because unfortunately, if we're looking at a particular vector, a single factor, we start applying a carrot, we apply a stick, carrot, stick, carrot. All of a sudden, you can end up with really counterproductive. So one step forward, one step back, you're still in the same place you started. And so it is important when you're thinking really macro level about designing legal frameworks to continue to step out from the weeds, step back up, look at the forest, understand, what it is that you're really trying to do, and make sure that we're moving the ball towards the goal, as opposed to just keeping everybody staying in one place, too afraid to move forward.
No, I love that. Definitely always looking forward to the next goal and what you can achieve. And as we're coming up to the end of our session, I just kind of wanted to get your opinion on how can investors and also legal professionals work together to create an environment that encourages healthcare providers to adopt and also succeed in value-based healthcare initiatives.
All right, I'm glad we got to this question, because I honestly believe the more risk and capitation that providers will take on, the more invested they'll actually be in and benefit from pursuing things that are hard to bill fee for service, right? So the digital tools that I mentioned, when providers have a universe to select from, they can improve patient outcomes. It's totally disconnected from whether or not they're going to get paid. Then providers themselves become the incubators for innovation. So if you think about it, if they've taken on risk and capitation, they don't really care how they get the good result, the value-based care, the patient-centered initiative. They just care that it's happening, because that's how they're going to make money. And if they have that freedom, if they get moved away from that fee-for-service model, then they're actually going to become incubators for innovation themselves. They're going to start to think about, how can we bring in this interesting tool? What can we do to actually make this better? And then you get investors who start looking at healthcare providers as innovators instead of just service providers. Once the investor starts seeing a healthcare provider as an innovator, and they actually are looking for them to validate those tools and achieve the outcomes, then we get an investment cycle and sort of a process that's more akin to biotech. And there you're going to have high risk, high reward outcomes, and all of this mind shift. If you can actually change the way people think about this process, providers need to be invested in it, patients have to participate in it, and investors need to reward this process. And then we will actually finally get to the ability to have, true value-based care initiatives being successful.
No, I love that. Thank you so much for sharing your insights and kind of sharing us both from the investor and the legal standpoint, and how we can both come together to create value-based care. Really appreciate you taking the time today, Bethany, again, to share your expertise on this subject. And it was great to listen to your session yesterday. And so definitely encourage everyone to see the recording of Women's Health Tech Wednesday yesterday. Bethany goes into a little more detail, being an investor as well as a lawyer. So with that, I'll hand it back to Stan. And thank you again, Bethany.
That's fantastic. Thank you, Ainsley. Thank you, Bethany, again, for joining us. This is what we like to see for the symposia that we have every month. Really these kinds of varied perspectives, and in this month, obviously diving into value-based care and having a much better understanding of what's going on in value-based care, coming out on the other side of this in terms of the digital technologies that are being provided there. And a big part of what we do at the lab, obviously, is community building, and we want to make sure that you all have a chance to amplify your community and amplify your brand in the global healthcare. And you can grow your network through events like this, more exclusive events that we have, like cocktail hours, getting access to insight, and then understanding what's happening with industry trends and different types of breaking news when you sign up, and you are signed up as a part of our community to our Digital Health Evidence Daily that put together the most important news headlines on the adoption of digital. Where is digital actually going? And either through funding events, new customer events, partnerships, exits, things like that, when we see digital ramping up through this digital health winter, if you will, this trough that we're in, ramping up to the next peak. And our prediction again is that we'll see phones, faxes, and paper generally, slowly, not all completely, but generally eliminated through the healthcare system over the next 10 years. And that's what we're all feeling. We're all feeling like there's a lot of things happening in the undercurrent. And as we're going into physicians' offices more and more, we're seeing less of those three things that really indicate an analog ecosystem, not a digital ecosystem. And that's what we're really trying to get to. So again, join us, be a part of our board and Breakthrough Alliance. Join us even as just a Breakthrough One member, and be a part of our community. So thank you for that. And just click on the scan button with your phone to join there. And speaking of our community, really happy to have Bill Taranto, the president of the Merck Global Health Innovation Fund, the largest innovation fund out there when it comes to digital health ventures. Again, one of the folks who helped get Livongo off the ground and funded that into its IPO and exits to Teladoc. And then Olivier Robinschlag, a West Coast maverick who recently departed Google and started up his own venture capital company, Chapter 3 Capital. And just an incredibly brilliant mind on healthcare. Just joined the board of the Breakthrough Alliance, our HITLAB's joint venture with New York City Economic Development Corporation, to bring digital technologies to the New York City ecosystem from all around the world. So Bill, Olivier, very happy to have you with us today. Thank you for joining.
Well, thank you, Stan. I appreciate it very much. I'm really excited to talk today with Olivier and hear about his journey and what he's really up to today. And I think the audience are going to be really excited about it as well. So as you know, Olivier, how we like to start these conversations is I like to understand how you got to where you are today. And remember, our audience is a mix of sort of entrepreneurs, we have investors, we have students, and I think it's really important that they hear, someone's journey. And so that's my first question, is introducing yourself and just, a little about your journey of where you started, and then how'd you end up today, which we'll get into more detail about Chapter 3, but, how did you end up where you are today and what your journey was?
Right. Thank you, Bill. And thank you all for having me here today. So yeah, I'm Olivier. I'm the founder of a VC firm called Chapter 3 Capital. And the way it started all many, many years ago, I was born in Germany, but eventually I went to art school in the UK. And so that was many, many years ago. And between now and then, working in the healthcare space, you can imagine lots of things have happened. So I'm a creative at heart. I come up with ideas. I studied design. And so I naturally progressed to become a designer, an art director, and creative director in the advertising industry in London. So that was my first career in advertising, working on big global, campaign launches, Visa, Gatorade, Nissan, the usual suspects, going from agency to agency. And I ended up doing that for 14 years. And after 14 years, I also realized that as exciting as it was to be creative and be involved in creating new content and big campaigns, more and more I realized that actually, the products that I'm selling, I'm not really interested in them because they don't really have an impact on people's lives or the planet, or, there's no bigger meaning behind, selling even more sugar water off the shelf. I just couldn't do that anymore. So after 14 years, I was lucky enough to meet a lot of very smart, inspiring people from Google. And so if advertising was my first chapter, the second chapter, if you wish, was Google. And so I brought creativity and the creative thinking into the technology world. And so I was lucky enough that the Google folks gave me the permission to start my own incubator inside of Google. What that meant is, as a creative person, I had access to a lot of really smart engineers who were working in their literally garages on their prototypes and APIs, not knowing what those could represent for the industry and the world. And so as a creative guy, I played off many assumptions of what the technology could represent for different verticals. So when you think about market fit, opportunity sizing, use cases with big global brands, partnerships, I was like an accelerator for their technologies. And I ended up doing that for 11 years. So 11 years working on those early prototypes. And then, well, what if we talk to Unilever or Nestle or Coca-Cola? How could we partner and do something bigger together? So in essence, I was scaling and productizing new tech. And then the third chapter, if you wish, after 11 years doing this, I just thought, now it's time to start my own company, to place my own bets on the next generation of companies that, one could argue could maybe become a Google. Mm-hmm. So, and that's what got me to healthcare as being one of the key verticals that I'm focused on. So yeah, a long journey.
Great. And now you're in chapter 3, which is what we want to talk about actually right now. So that's a fantastic journey. So let's talk a little about your recent Breakthrough Alliance member and board member. So we're happy to have you as part of the board. And also now running your own venture capital firm. Can you talk a little about your decision to join not only the Breakthrough Alliance, but really, what's the impetus behind chapter 3? What are you focusing on, and what are you trying to build with that particular venture capital firm?
Sure. Let's talk about the Breakthrough Alliance first. So I've been working with HITLAB related to the Alliance for many years now, going back to my days at Google in my function there, and talking to symposiums and just collaborating with the board, with Stan, with the whole organization. But my contributions and participation sadly was always very limited because I was tied to Google's agendas and crazy timelines, calendars. I could never really fully live the connectedness to HITLAB and the team. And now that I created chapter 3, I'm free to do whatever I want to do. And I also need to be smart about who I spend my time with and on what I spend my time on. And I feel like if I want to create something magical and truly groundbreaking for the healthcare vertical and the pharma worlds, to me, HITLAB and the Breakthrough Alliance, to me, is like the standard in the industry that helps me identify new opportunities, meet leaders like yourselves in the space, subject matter experts, access to technologists, and and also the whole research body and expertise that Columbia represents. So all those things coming together, I'm like, yes, I would love to join the Alliance. So thank you for having me join, and that's now really what I'm mostly excited about. And the reason why I started Chapter 3, because after building other people's brands that are already massive, and some of those dinosaurs, after building and scaling those for many years and helping them, I'm mostly excited about the next generation of those big companies. So I'm a builder at heart, 0 to 1, not 1,000 to 1,000,000, because by the time I left Google, it was a very different company, and that wasn't that exciting anymore.
All right, well, let's talk about building companies. It's my understanding that some of what you're going to be doing with Chapter 3 is focusing on value-based care solutions. Mm-hmm. And why is it important for you to start there as at least one part of what you're trying to do? Why is that important, do you think?
Well, coming from Google, where the only thing that matters is data, from performance reviews to measuring impact of prototypes to measuring the impact of driving someone's business. It's all about data, because no one can argue with data. And if you have data and you measure that data and you understand that data, then if you translate it into the healthcare world, by putting the patient and the human being first above anyone else or any other entity, I think that is how truthfully, fundamentally, we can change people's lives, because we can then measure the impact of treatments, of medication. And it can be as vast as not just focused on the patient, but also related to the patient when it comes to, trials, discovery, supply chain, anything that's related to giving care to patients and being able to measure that. All goes back to data. And if there's one thing I understand after all those years, it's data. And that's what I'm excited about, the opportunity.
Yeah, well, we have that in common. One of the CHI's fund's big belief is data is the currency we're going to use to transact in that future healthcare market. So I want to talk a little bit more about that. One of the things that we see with digital health, it's hard to come up with the right digital health strategy and the right tools to be implemented, and then even scaling. And just kind of your thoughts on how you potentially see the implementation of the right strategy and tools, and then how you might think about scaling, because that seems to always be the hardest part of digital.
Mm-hmm. I mean, my take on this, zooming out, thankfully we are in 2023, where I think technology, specifically AI as an example, is so sophisticated and is so capable then that I truly believe we can build anything that we want to build. It's more a question of, is it the right thing to build in the first place? And so when I think about the data that's now more available to us than ever, for many years, I believe we have had access to data that was very unstructured, and therefore it wasn't very usable, and it was just sitting on a shelf, which now, based on what we now know, was a missed opportunity, because now technology is so smart, you can pump in unstructured data, and the system and the technology has become so smart that they can structure the data to get to insights that eventually will become very actionable and real. And that's why I think working with those systems now more than ever, from a strategy perspective, again, we can build anything that we want to build, and we can build. And also we can get to insights and actions faster than ever. So that to me is a true opportunity.
Sounds good. Okay, we have time for one last question, and it's a little get more focused on Chapter 3, and then so me as an investor, and then we have a lot of the audience that are entrepreneurs. How do they work with you? Are you stage agnostic, or are you early seed? Who should be contacting you, and how do they do that?
Yeah, so I started Chapter 3 as like my own little angel fund. So I've been investing my own money into companies that I believe in, based on the knowledge and expertise that I've gathered over the years. But now that Chapter 3 is growing and exposure is growing, yes, it's definitely early stage, pre-seed, seed, and my goal is to work with the founders and partner with them to help them get to Series A and beyond. The way I do it is obviously when you think about the alliance in HITLAB, when it comes to the healthcare vertical, working with experts and leveraging my network and really rolling up my sleeves to be action oriented versus many other VCs who just put money down and say, please get me a return 5 years from now. Let's talk then. I'm the opposite. It's not just about an investment, but it's also the ability where I believe I can actually contribute true value. I would never invest in a company where I don't have the network, I don't have the expertise. Yes, I'm a marketer at heart, but I have no idea how to market your product. This is all about basically look at me as an advertising agency / Google network. Can I combine those to deliver value? And so a lot of times I love the product, but I have no idea how I could literally help. If you ask me tomorrow at 9 o'clock to show up and work on something, if I don't know what I would actually work on, I wouldn't be able to partner as much as I love the idea.
Well, fantastic. Well, Olivier, thank you so much for your time. First, let me be the first to welcome you to the board of directors of the Breakthrough Alliance. I'm excited to have you be part of that. And wish you best of luck with Chapter 3, which you're now embarking on. And to the audience, if you're not a member of the Breakthrough Alliance, please join me. If you're not a member of Breakthrough One, we ask that you please join because it's a wonderful network of people that I think you want to be involved with. With that, I'll turn it back over to Stan and continue the program. Thank you, Olivier.
Thanks, Bill. Thanks all.
That's fantastic. Thank you, Bill, and thank you, Olivier. Just an amazing program for them to be running Chapter 3 and is up and running. By the way, he is writing checks, and I just popped his name into the chat box one more time. Olivier has already funded 2 HITLAB companies, and he's looking for more to fund. So do link in with him if you are a startup and you're looking for venture capital. Again, he's an angel, so he's not writing you a check for $1 million, but less than that, he'll talk to you. So do link into him and do connect with him. In the meantime, we are going to be launching a poll, as you all know, and as we've discussed, the November Innovator Summit, the 11th annual meeting, will be taking place coming up not only in November of this year, but over the next year. We'll be looking for more topics to talk about at these symposia. So if you could please take the poll, you can vote as many times as you want, and you've got about I think 30 seconds left to answer these questions. But it's health equity, it's artificial intelligence, it's machine learning, it's the metaverse, it's women's health, investment trends, mental health, emerging technologies, what's working, what are we testing, and what are we seeing actually working. It's adoption, obviously one of our cornerstones, evidence-based adoption that we follow based upon our own scientific testing and IRB-approved studies, et cetera. So if you could just pop in whatever you see there that is interesting and that you really feel the need to have more insights on, more learnings on, what evidence are you trying to check into? We're closing in 10 seconds, so vote quickly, or just instant message me on LinkedIn, and happy to take whatever you're sending over on LinkedIn and add that to the group that focuses on forming the topics for the next year at the lab. So thank you all for participating in those results. And just to give you an idea of some of what we have, these are the results that came through. Obviously, health equity is a big part of what HITLAB was founded on and works on every day. That was one of the top ones. Artificial intelligence, which is something everyone is trying to understand more of these days. And then health tech adoption was in the top 5 as well. So thank you all for participating in that, and we will send you all an update on that within the next week or so, and ask for more feedback, as obviously you all are driving the community at the lab and driving the research agenda, and we appreciate your feedback on that. So next up on the agenda, we are really happy to introduce to you all Robert Rodriguez, who many of you know about, and certainly he's done some amazing things in healthcare. And Jerry's going to talk with him over the next 10 minutes to find out more about his latest startup, Helix VM. Jerry, Robert, welcome to the program.
Yeah, cheers, Stan. Thanks so much. Robert, pleasure to have you on the program for the first time, I think. And for those of the audience that haven't had the pleasure of meeting you or working with you, we'd love to get a quick 2-minute background on yourself.
Fair enough. I hope everybody can hear me. Name is Robert Rodriguez, native of the New York area, and been doing healthcare now for about 20 years, actually. On September 26th of 2003 was when I jumped into the pool, and I've been swimming in it since then. Prior to that, business school guy. I'm a non-physician in the industry, business school guy who did consulting, did a fintech startup and some buy-side work at a large company up in Connecticut. So pretty varied background. Last 20 years, however, it's been pretty much in the salt mines. I started literally with my first company, basically that I started, working the front desk, like literally checking in patients, seeing the patients, dealing with all of the stuff that you have in that environment. And then fast forward a couple of years ago, started Helix VM, and purpose of that is we're trying to build a platform to make the assembly of medicine easier for the physicians. So that is that's our goal.
No, really, really wonderful, and great to hear about how you sort of started off, sort of from the ground up and real grassroots stuff, and to sort of evolve to where you are now with Helix VM. Now we're very, we've got the pleasure of being able to work with you guys right now on a project we just started. But if you could tell the audience a little bit about sort of how Helix VM came to be and the impact that you guys are making on the industry at the moment.
Okay. So Helix VM came to be, it's an evolutionary process, which is to say, dealing with a lot of the issues inside retail healthcare. So I started kind of with urgent care, right? So you're seeing all types of patients in all types of scenarios. And, one of the things that I noticed, pretty early on was the fact that, getting information from patients, getting information from their referral sources, getting that information to physicians, and then obviously turning that back around is a pretty inefficient process. And so, time passes, technology moves forward, COVID hits, and all of a sudden there's this huge premium on being able to see patients quickly and efficiently because we were crammed. We were so busy, it was crazy. But, long story short is the idea to Helix VM was to basically try to make that assembly process easier. So fundamentally speaking, it starts with getting confirmed bookings on patients. So part of our platform and our software is about confirming a booking. A booking is not just a booking. There's a lot of information that has to be aggregated. We help aggregate that. We aggregate it directly from the patient most of the time. We also sometimes aggregate it through a third-party source. So that's part one of the platform. Part two is our clearinghouse, our AI clearinghouse for triage. And the purpose of of that is to basically try to create for the physician, in essence, a medical note, as close to a medical note with suggestive ICD codes, in order to simplify the amount of time a doctor spends with the patient. So for example, I noticed somebody had made a comment in the chat about how you have to actually use AI to make it easier for the doctor to spend time with the patient. Well, I would say that that takes two different forks. One is there are certain patients you don't need to spend much time with and you just need to get them in and out. And then there are other patients that you need to free up time to spend more time with. And I think part of what we're doing within our triage clearinghouse is trying to, in essence, segment that flow. So that way, as the doctor is seeing the patient, they're able to, in essence, spend more time or less time, even to the point of combining that AI with what we call kind of standby templates in order to fast track treatment. And we can, there's a lot of detail there in terms of how you do that. But fundamentally speaking, it's an AI-driven process. It's about bringing in a lot of subjective data from the patient, bringing in objective data when possible from some of the common systems that we have in the healthcare space. And then last but not least, it's also putting together what we would call kind of a discharge and rebooking system for that patient, which is to say, a lot of times when you bring in a case, you bring in a patient, there's always more work to do. The question is, what work is there to do? So we basically have put these three pieces together in order to start actually seeing patients. And the net is, what we've experienced is that we've been able to cut down the physician time by about 50% in terms of the applied time. And that savings tends to come from The physician not having to spend time doing triage, which many times they do. The physician being able to read the note ahead of time before actually physically seeing the patient. So that way they have a pretty good idea. And also having from the AI a suggestion. Hey, listen, this is what I think the diagnosis is. Obviously, you as a physician can determine what it is, but this is a suggestion. So it sort of, to some degree, I would say cuts down the guessing, while at the same time allowing the practitioner to really focus on the problem of the day and on trying to treat that patient.
No, that's really awesome. And if anyone wants to find out more about Robert and what the great work that they're doing right now at Helix VM, I think we put the link to Robert's LinkedIn in the chat, as well as the link to the platform itself and their website. So yeah, Robert, thanks so much for coming on. A real pleasure being able to speak with you on the program. Looking forward to catching up again next month to see sort of how the project with HITLAB has gone and seeing the progress that you guys have made with Helix VM in the next symposium.
Absolutely. Nice to meet everybody.
Thanks so much, Robert. Virtual round of applause for Robert, everybody in the crowd, and I will hand the mic back over to you, Stan.
No, it's fantastic, Jerry. And again, thank you, Robert, for joining us today, and really appreciate your time. And for those of you who are familiar with these sorts of companies that get into the mix and really into the middle of the ecosystem, this one reminds us a lot of the Cover My Meds launch and sale. If you remember, they sold to McKesson for $1.1 billion. A group of former Cardinal Health executives out of Columbus, Ohio, went to Cleveland, started Cover My Meds in 2011, sold it to McKesson for $1.1 billion in 2017. One of the fastest ideas to IPO, to exit, so that we've ever seen in digital health. Just a transformational story. And with Robert's background and the tech platform that he's developed, really looking to see big things happen with these folks as well. So next up, we're real glad to have Riley come back, and hopefully we'll have this one kicking off with Anjana, and learn more about what she's doing on her journey as a global chief health information officer as well. Riley and Anjana, welcome back to the program.
Thank you, Stan. Anjana, it's a pleasure to see you. Thanks for taking the time to chat with us today and share your story. So let's just start there. Please go ahead and introduce yourself to everyone else here.
Yeah, thank you, Riley. And thank you again for this opportunity to join all of you today. So just by way of background, I have about 25 plus years experience, and looking back on my career, spent the early part in consulting and have spent the rest of the time in the industry leading technology teams across several Fortune 500 companies. And I'd say the common thread as I reflect back on those experiences, it's really about driving change and driving transformation. I think that's kind of the common theme and thread that has strung along all parts of my career. So maybe just with that background, let me hand it back to you, Riley.
Yeah, of course, absolutely. Can you provide an overview of the role that digital strategies play in enhancing patient engagement within healthcare contexts?
Sure, no, happy to. I'd say it's increasingly digital strategies are playing a significant role in patient engagement. And as all of us, even if you're a patient, you're a consumer, and as consumers, we're leveraging digital technology in all aspects of our lives. And so I think we've gotten accustomed to, which is good, in leveraging tools and kind of want to leverage the same types of tools for managing our health as well. And managing health is pretty complex. So that's why a wide host of, I think, types of tools have come into play. And I think when I think about what are the needs of patients across this landscape, I think it's many. It's about getting easy access to health information, looking for convenience factors. How do you manage all aspects of your health, whether it's paying the bill or scheduling or any of these aspects, kind of looking for tools and ways to understand your own health and kind of thinking about personalized insights that will help you. So I think it's certainly a fantastic time when digital technology is really able to play a significant role. And if I have to sum up this opportunity, I would say, Riley, it's in one word, I would say it's empowerment of the patient. I think that is the opportunity that digital technology has in continuing to enhance these patient engagement opportunities.
Yeah, and speaking to those, technologies and specifically the needs of the patients and the healthcare providers, what sort of evolution are you seeing in those digital tools and the technologies? How can they help to grow and advance to meet some of those needs that you've mentioned?
Yeah. So I think when you take a step back and kind of look at the entire industry itself, or healthcare industry, there's a lot of macro shifts that have taken place over the last several years. And I think there's a few of these have already been touched upon by the previous speakers. It's value-based care, kind of focusing on outcomes. It's about patients picking up more of a cost burden, if you will, which starts to put more skin in the game in kind of thinking about where and how they want to manage their health. So a number of these macro shifts, I would say, Riley, are really helping to evolve the digital tools and kind of making sure the right tools are available to help meet those needs of those shifting needs of the patients, if you will. I was just looking up the other day, and when you go into a mobile store app or Apple Store, there's about 350,000 apps when you look at the category of health and fitness. So just tells you the sheer amount. Now, many of those may not be exactly health, it may be fitness related, but just the overall nature of kind of the number of apps that are there is just staggering when you think about it. And there's a whole host of examples, everything from EHR systems to telehealth has really made a pretty big evolution as it comes through. Remote monitoring, so you can have better access to information, whether it's your blood pressure monitor, whether it's your blood sugar, therapy-related applications, as well as kind of things about your healthcare costs and billing systems, et cetera. I think there's a whole host of evolution to meet those changing needs, if you will, across the ecosystem.
Absolutely. Yeah, those are all great examples of how the evolution of those digital strategies has occurred. And, I really love that, empowering the patients and having that be a focus of those digital strategies. What are some of the ways that we can actively empower patients so that they can take a more, centered role in managing their own health and wellness?
Mm-hmm. So I think the biggest advantage, I would say, Riley, in digital technologies is gives access to information, which is truly empowering. And as I said, puts more skin in the game to bringing in more accountability, being aware of one's own health and how do you manage it. And I'll give you my own recent example. I was recently had a little bit of insulin resistance, and I was trying to figure out how best to kind of manage my own health, what's the right dieting tools, and I was getting frustrated because nothing I did seemed to be working. And then I decided to use a continuous glucose monitor, which kind of tells you your blood sugar every time you eat, real time, it tells you information. And it was amazing as I went through, just as my own example of kind of, it was eye-opening as I kind of looked at every part of any food that I had and kind of real-time effect of that it had on blood sugar. And I think what was a very difficult thing to do or figure out the right diets, I could personalize and kind of think about how best do I fine-tune my own diet to kind of meet the needs that I have. And so that's just one example of how digital tools can really empower a patient, provide the right information so that we can make the right choices, if you will. And whether it's medical follow-ups, and adherence is such a big problem in the industry. So tools can help you improve that adherence and kind of making sure that that patients kind of follow up on therapies, they take their medications. So there's a number of ways I think that empowerment can really be bolstered by leveraging these tools.
Yeah, that's amazing. I really like that. And thanks for sharing your story. It also puts into mind that as healthcare practitioners, we're not only treating a patient, but we're helping to educate a patient and teach a patient. And so I think it's important that, these digital technologies and ever evolving solutions include that education piece while also providing the access to information and everything that you just shared with us. So we've got all these great ideas. The landscape is evolving. Everything is improving. But what are some of the biggest challenges that you see to help keep the ball moving forward and help this evolving landscape in these digital tools?
I think one of the challenges I would say is similar to kind of, it is a good thing, as I talked about the number of apps that are out there, but it's also overwhelming as you think about it. As a patient, it can be lots of different information, helpful, but it's all fragmented and it's just a lot of information. So I think that's the biggest one I would say. And then when you look across our healthcare ecosystem itself, lots of different information in different EHR systems, different hospital systems or providers that you go through. I think it's the fragmented nature of our entire landscape. I would say that is probably the biggest challenge that I see in overcoming and kind of simplifying it to help a patient. I think that is the most important. Currently, there's no single pane of glass to kind of look at the holistic health of a patient. And the more we can all work together as part of an ecosystem to help pull all this together, that'll be great.
Yeah, absolutely. Sometimes it feels like there's almost, too many options for one person to choose from. And that can, while we're trying to provide access, that can actually limit patients' abilities to find the specific right solution for their need. And speaking of providing these solutions from an, educator and thinking about the human touch of the solutions, how do you balance that between, the digital technologies versus comparing and adding in the human touch so that you can really get those meaningful patient interactions?
Yeah, that's a great question. And I would say what's important is kind of having this sort of a omni-channel digital strategy that kind of helps you both incorporate the digital channel, but also the human touch, which is so important, as you talked about. It is so important to have that meaningful interaction. So I think it's the kind of some of the things I think to keep in mind as you're designing the strategy is kind of making sure that you meet the patient where they want to be met. So sometimes it's the digital channel, sometimes it's the personal human touch. So kind of provide all of those options and meet the patient where they want to be. The other thing I would recommend is kind of integrating all of this. So that it becomes seamless. So regardless of where you come in, and this, of course, on the back end, being a technologist, I know how critical but difficult it is sometimes to integrate all these various systems. But it's really important to kind of having an integrated solution to be able to help the patient. And the last one I would maybe add to the considerations is kind of thinking about where is the more complex interaction where a human touch is actually beneficial versus those where I just need simplicity of information and I want to be able to get that. So kind of look at it from complexity to kind of think about how you want to design your omni-channel strategies to kind of bring the best of both digital as well as the human interaction, if you will.
Yeah, that's excellent. And speaking to the fast-paced nature of technology and the need for all of these different multi-channel connections to get feedback from the patients and help involve them in the journey, what can healthcare organizations do to stay current, stay adaptable, and just meet the needs of this ever-growing landscape?
Yeah, no, it is growing and growing very fast, which is exciting on one side, but as you said, you got to be able to keep up with it. So I would say look at it as an ecosystem. Look at it as an ecosystem play where you can not only not have all the answers yourself, but are reaching out to other partners to be able to upstream and downstream within your own patient journey for you to be able to connect, understand how they're doing it so you can kind of keep up with it. Partner with startups. There's a wealth of lots of startups with great ideas, and that gives you a fantastic way of keeping abreast of tools. Connect with all the thought partners and consulting partners to be able to bring some outside in thinking, and also look outside the industry. Sometimes we just look at the healthcare industry because that's sort of where the patient is. There's so much we can actually learn and be inspired from with other consumer engagements that may be happening in other industries and kind of bring that in. So I think there's a lot of different ways to kind of stay abreast and kind of think about what's the best way to kind of bring all of this to inform your strategy.
That's excellent. Yeah, I really like that, cross collaboration and working together from an organizational standpoint. And that flows all the way through to including the patient and, in centering along that human touch and empowering the patient as we develop these different solutions. I'm going to put you on the spot here a little bit. I want you to give me your most exciting possible digital strategy that's on the market or on your horizon, or something that catches your eye in the digital health space.
Yeah, and I think for me, if I think about sort of the future and what's exciting, I think it's really about the continued leverage of AI technologies. I think we've all been using it in different forms, so it's nothing new to healthcare itself, but certainly a lot more that we can do to enhance patient engagement. So I'm really excited about generative AI to be able to engage with patients, especially maybe older patients, to be able to guide them through a very complex healthcare system that we have, to have integrated solutions that we were just talking about, to provide the holistic care for patients, and maybe to end on personalized care. I think that for me is the holy grail of sort of predictive insights to be able to guide a patient and hopefully improve care and prevent it before it actually happens. I think that is what excites me in the future as I look at where this can all go from here.
Awesome. Well, thank you very much again. I know we had you for a Women's Health Tech Wednesday. We are lucky enough to get you again here for our symposium. It was great to connect with you and hear your thoughts. And thank you again for taking the time to be with us today.
Thank you so much. I appreciate it.
All right, I'm going to pass it back over to Stan.
Super, Riley. Just a great session, and what an enormous amount of in-depth comments and insights from just a tremendous leader in the ecosystem. Thank you both. So we have, of course, as you all know, we have the Innovator Summit coming up in November of 2023, in just a few months now. I can't believe September 1st is tomorrow, but looking forward to seeing an incredible audience there of decision makers and digital health startup leaders and executives from across, certainly employer, payer, provider, life science, academia, government. So hoping you all can all join us, and looking forward to seeing you there. Just click on the scan button in the lower right-hand corner to get your tickets today. And of course, be a part of that community. Really just the number of interactions, the number of educational sessions, and certainly transactions we've seen over the last really 2 months, July and August, since the New York City Digital Health Week at the end of June this year. Just an incredible number of transactions, partnerships happening, investments happening, and sales happening with folks who are buying and purchasing different products, digital health products, to test and to pile into their ecosystems. So we are officially on hour number 2 of the August Symposium, and we're going to kick it off with our own colleague and partner, Juan Jimenez from AcuCardia, the recently FDA approved AcuCardia, I am happy to say, and thrilled to have Juan joining us. And Juan, how are you doing?
Thank you, Stan. Can you hear me well?
I can. Yeah, you're coming in loud and clear.
Awesome. Thank you, Stan, and thank you, HITLAB team, for organizing this event and inviting us to participate. Looking
Fantastic.
forward to share our news.
Yeah, let's start off with an overview of AcuCardia for the audience of folks from around the world who are tuning in. For those of them who have not read the newsletters and the blurbs that we've passed on with all your success, just give a short overview of AcuCardia's FDA-approved ECG technology and some of its key features that are helping value-based care become more successful.
Great, thank you. AcuCardia, we have a mission to improve patient outcomes in the cardiovascular space by delivering the best ECG interpretation software available, so we can enable remote patient monitoring worldwide. Our first FDA-cleared product, it's AcuECG, and it is a technology that ingests ECG signal coming from wet electrode devices and perform automated analysis in a similar fashion to what a cardiovascular technician may perform. So we fully automate the analysis of the ECG signal coming from devices such as Holters, cardiac patches, event monitors, and we perform automated analysis, and we provide physicians with a report that they could act upon a particular patient condition if need be.
That's incredible. Yeah, and just tremendous success there. Tell the audience and tell us a little bit more about the ECG technology and how it aligns with value-based care. For some folks may not understand value-based care, and certainly most people understand ECGs at a root level. But what are the specific aspects of AcuCardia's ECG technology that really help help the value-based care system address some of the issues there?
Sure. The best way to explain it would be with an example. So I think it's the easiest way maybe for the audience to understand. Let me take the example of stroke in the US. Strokes is an event that affects around 800,000 patients in the US every year. The average lifetime cost for Medicare for each stroke event is around $200,000 just on medical costs. Like, if we have to add rehabilitation and income loss, is a much higher number, but just on medical costs, it costs around $200,000 per patient in the US per year of any stroke event. By identifying undiagnosed or misdiagnosed atrial fibrillation and prescribing those patients with an anticoagulant drug, which could cost between $20 to $500 per month, we could help the healthcare system prevent this large medical cost of stroke, as well as saving lives and improving the quality of care of individuals living worldwide. Just to give you an example, by treating an undiagnosed AFib patient, we can reduce the risk of a stroke by up to 70%. So if a doctor prescribe an anticoagulant, let's say in a generic form, cost $20 per month, or in a more newer drug, it may cost up to $500 per month to treat that patient in anticoagulant, helping reduce the risk of stroke of that particular patient. Let's say the doctor prescribed a more expensive drug, still the break-even point for the healthcare system is if the average life of that person with treatment with a stroke is around 33 years post the diagnosis, still is worth it. Spend the money from an economic perspective in treating that patient with that drug for up to 33 years while preventing the stroke event, as well as helping that person get a better quality of life without suffering from an event such as a stroke. So I think that is an amazing example how by adding technology that could identify undiagnosed or misdiagnosed events such as AFib can help prevent with just stroke population in the US.
That's incredible. And doesn't value-based care also involve enhancing patient experiences? And tell us a little bit about how AcuCardia's ECG technology impacts the patient experience during these kinds of diagnostic procedures.
Sure. We have designed our technology to be compatible with the current clinical workflows and help patients reduce the burden of additional hospital or doctor's visit. For example, if you have a particular individual suffering from a particular arrhythmia event, they may have to go to a doctor multiple times and get multiple devices to be worn for a particular condition. By improving the diagnostic capability of available devices, our technology can help reduce the burden for a particular patient to be administered multiple monitoring exams as well as multiple doctor visits. On average, we can save up to 2 visits per patient after using our technology, as well as reducing the needs of multi-step therapy, multi-step diagnostics, so we could identify the disease earlier rather than spending more time and more resources trying to find a condition that may not be there under the current workflow settings.
That's brilliant. No, this is so exciting, Juan. Really happy about. By the way, don't forget, everyone, Juan is a product of Columbia Business School and an MBA alum. And so very proud to see that synergy there too. So by the way, if you could tell the audience a little bit about some of the real world examples or case studies where AcuCardia's technology has demonstrated this kind of clear increase in value-based care, whether it's either on the cost saving side or if it's on the improved patient outcomes side, or maybe some other relevant metrics that you might have. But dive into that for a minute. We got 2 minutes left, by the way.
Awesome, thank you. So I think we can our real life impact in the analysis of ECG coming from Holters or event monitors, comes in different areas. One is the reduction of cost for the healthcare system. We can help increase the efficiency of the cardiovascular technician analyzing such recording by up to 70%. So each cardiovascular technician, for each staff hour performing ECG interpretation, we could increase their throughput by up to 70%. Second is about time for diagnosis. On average, we could perform our automated analysis for a 24 to 48 hour Holter in a matter of minutes. Current workflows require multi-step process, as well as 2 days up to 1 week worth of waiting time for patients to get the information back from their recordings. So by reducing the lead time spent by doctors to get back this kind of reporting, they could start treatment earlier and improve patient outcomes and save lives, which is the goal of AcuCardia.
It's amazing. Well, Juan, this has been an amazing 10 minutes. As always, it's always great talking to you to begin with, but it's great now that you can share some of this amazing news with the ecosystem and certainly the hundreds of people on the program now, and certainly that'll tune in over the time. thank you very much for joining us today, and enjoy the last day of August. Have a great holiday weekend. We'll talk to you later.
Thank you. Bye.
Just an incredible FDA approved platform there with Juan and all the good stuff that he's doing at Cardia. And don't forget to sign up for the Women's Health Tech Wednesdays, an incredible schedule coming up this semester happening. We've booked up the next 3 months with women who are leading the world right now in health tech and venture. And every Wednesday from 12:30 to 1 p.m. Eastern Daylight Time, we have amazing guests, and it's hosted by Nina Joshi, who is the head of UX UI at Kaiser Health Plans. And just click on the QR code in the lower right hand, scan there and sign up for that. Looking forward to seeing you on there too. Again, very much like this, very interactive, lots of people chatting with each other, sharing LinkedIn and connecting while listening to brilliant people talk about important insights and learnings and digital health evidence and what's happening in the world of digital health tech. Next up, we have, again, HITLAB's own Jerry Antamano interviewing the clinical professor of strategy and director of healthcare at Northwestern Kellogg, Paul Campbell. So Jerry, Paul, thanks for joining us.
Cheers, Dan. Thanks so much. Great to be back on to be interviewing Paul Campbell from Northwestern Kellogg. Paul, great to have you on the program. We'd love to hear a little bit of a background about yourself and how you came to be where you are right now.
So yeah, thank you, Jerry. It's wonderful to be here. I did not grow up in academia. I was a lawyer that thought if I went back and got my MBA, it would make me a better lawyer. And business school completely ruined me as a lawyer because I realized I wanted to go to the business side. Ultimately fell in love with healthcare, was on the payer side with United Healthcare for many years while teaching as an adjunct, and then joined the faculty full-time here 4 years ago, and also serve as the executive director of the program.
Awesome. Yeah, we're getting a couple of smiling faces in the virtual reactions from the crowd from your description of your background. But yeah, awesome to have you in the program. Thanks for giving us a bit of an insight to your background. We've had a couple of startups on today that we've been working with, so we'd love to sort of maybe start the conversation around your perspective as to like the primary reasons for the disconnects you may be seeing between startups in the value-based care space and the funding that they're looking for, that they need to drive their solutions, and maybe if you can touch on some of the recurring challenges that are sort of hindering that process.
Yeah, so I think there's no shortage of challenges, and Stan said in the last segment that maybe not everyone understands value-based care. I think it's really important to understand the value chain in healthcare. So a simple definition of strategy I like to use is an interconnected set of choices that positions you on the playing field of your choice in a way you can win. And what I like about that definition is that it forces you to visualize a playing field. And if there's a playing field, there's got to be other players. And I think sometimes we don't spend enough time thinking about them, focusing about them. It's the old with them. Right? What's in it for me, or maybe what's in it for them? So very briefly, the three that I want to talk about today is patients, providers, and payers, right? And we'll go in ascendancy of difficulty. Patients, I think most startups, most companies, they think about their customer, but are they really doing it in a way that's focusing on quality versus cost reduction versus, as Stan said, the patient experience? Right? And you've really got to understand what is your unique value prop in that arena. Providers, being married to a healthcare provider, I'm contractually bound to sort of talk about how much they obviously care about good patient care. But as Lincoln famously said, all men and all women act on incentives. So the question really is, what's going to drive them to change clinical care models? I want to take a moment and put a plug in for a book. I didn't write this. I get no commission on it. It's recently come out by James and Robert Rybitzer. Why Not Better and Cheaper? And now you probably can't see it, but it's 115 pages. So I think it's uniquely positioned for a startup because it's a quick read with a lot of great information that really gets into the heart of incentives around healthcare and it talks a lot about the norms of providers. So let me quote one little piece. They were talking about AI, which I know just was talked about earlier today.
Mm-hmm.
Quote, if this provokes an adverse reaction from professional peers who may view the changes as undermining the art of medicine, even a powerful financial incentive may not be sufficient for the innovation to be adopted. At the heart, do doctors really believe that this is going to improve patient care, or do they think this is just going to make the hospital more money or a payer more money, right? So that really is at the heart of that professional norm. But then asking questions like, what drives their revenue? How do they get paid? It really comes back to these alternative payment methods, which I know is difficult. They're evolving, but they are the future of healthcare. And if you don't have a sense of what the different alternative payment models are, what value-based care is, and how that's going to impact whoever you're trying to sell your product into, there's going to be a disconnect there, right? There's a difference between a primary care physicians and orthopedics and nursing homes. So you have to really kind of understand their business model. And then, of course, there are economics behind the commercial market versus the Medicare fee-for-service versus the Medicare Advantage market. And then if you get into Medicaid, it's fee-for-service versus the ever-growing managed care. And I know with a startup trying to think about everything that goes into that, that is not easy, but you've got to be able to understand some of these. There was a startup recently that asked me, what's the difference between Medicare and Medicaid? You've got to understand some of those fundamentals. And then payers, they're the most difficult, but the first question you have to ask yourself is, does the current reimbursement system pay for my product or solution? Is there a CPT code? Can I get compensation now? Because if you're trying to create a whole new sort of reimbursement system, that is a huge rock up a very steep hill. And then I think the second question that people don't really sort of address fully is, does your product or service sufficiently materially improve a standard of care, right? It can't just be something that's good or something that's better. It's got to be sufficiently material improvement. Other questions, who's the ultimate buyer? Are you talking about selling into a large payer like a United, an Aetna, a Cigna, a Humana, or a single state blue? That can dictate a little bit your approach. Is this product or solution fit with commercial? And is that ASO versus fully assured? I know I'm using the alphabet soup here, so I hope if anything that just tells people they've got to do some basic homework in that regard. And are you trying to address the Medicare versus the Medicaid market? And then finally, do you understand the way the industry thinks about quality? Stars ratings for Medicare Advantage, HEDIS scores. 90% of health plans use HEDIS scores, and you've got to be able to understand how your product impacts HEDIS scores, or if it's a risk adjustment model, what's the RAF score? So at the end of the day, know the playing field and know what matters to some of these other key players.
No, really, really awesome. Really great analogy to start off with, Paul. And, I think it's, with you're getting a lot of responses in the chat about, you be really spot on around, really looking at the fundamentals around what these startups sort of need to focus on, in order to be able to sort of think in the, from the other, from those sort of perspectives. When they're sort of looking for that, that type of funding. I want to, just as we sort of wrap up, I want to sort of like look, I suppose, onto the other shoe in terms of your insights around, the healthcare incubators right now, the accelerators and the different innovation hubs that are working with these startups and their role in sort of helping these guys in value-based care refine their solutions, and they're connecting to these different funding opportunities.
Well, I have to admit, I have never worked in a startup, but I can only imagine, and from talking to them, I know that there's always a need for that support system around them. And I think the first thing any investor is evaluating is the team and who they invest in you as much as the product. So I think being part of an accelerator, part of an incubator, I know we have many of them here in Chicago, it really helps you to enhance your team and tap into that network that you need to be able to understand some of these larger trends. I think it helps you on scalability. It helps you with resources in terms of understanding the regulatory environment, which is another area that we haven't even begun to touch on. And I think it'll help you in terms of continuing to improve your business model. If you're not using the business model canvas as a startup, you should be. It's a way to just continue to iterate, which of course is such an important component of any startup. And being part of that community, being part of an incubator, in addition to the financial support, is just, I think, the support for you to be creatively thinking about your business model.
Yeah, some really, really great insights there, Paul, and I'm sure so many more insights that you can share with the crowd. Unfortunately, we're at time, and I'm sure the crowd would love to hear more about the different insights that you have to really help a lot of these startups come through the ecosystem. If you are in the audience right now, please do feel free to connect with Professor Paul Campbell. His LinkedIn information is in the chat. I'm getting a lot of requests here as well, Paul. If you could put the name of the book into the chat as well before you pop off. A lot of folks here are eager to look into it. But thanks so much for your time, Paul. We really appreciate you coming on and sharing your insights. And hopefully some of the founders here in the chat will connect with you and you guys can continue that conversation.
Great. Thanks for putting on a great event.
No, thanks so much, Paul.
Bye-bye.
Stan, back to you.
Great interview, Jerry. Thank you for doing that. Great coverage on some really important issues and certainly understanding value-based care. Along that line, again, if you are interested in understanding more about value-based care and getting more exposure to folks like Paul in a more intimate environment, both online and in person, again, scan the lower right-hand corner and on the QR code and join us with the Breakthrough One membership. Again, hundreds of people from around the world that you can connect to, amplify your brand, and improve your overall understanding and insights of what's happening in healthcare. So that would be just incredible, and would love to see you in the Breakthrough One network. And then along those lines, we have other things to tell you about as we move the slide forward a little bit at a time here. We've got more different benefits for Breakthrough One. We can talk about accelerating your networking opportunities, obviously things like this, being able to improve your insights, and then also making sure that you have access to the slides and the transcripts from all of the events that you see, all the educational programs coming on through the HITLAB. And then obviously we want to make sure that your network is expanding as well. So not just your learning, not just your education, but your connections to the ecosystem. And that's it for Breakthrough One. With that, we are now doing very well, going through our number 2, running a little bit behind, but we are at the 12:20 segment with Derek Brand, a phenomenal digital health thinker, an amazing ecosystem builder coming out of New York City, and just having an amazing understanding and insights onto what makes an ecosystem tick and what are some of the key attributes of that. So with that, welcome Derek Brand, who is the Executive Director of Strategic Partnerships and Development at the Columbia University in the city of New York. Derek, how are you? And it looks like Derek.
I should start my video. Yep, hold on.
Derek is jumping online in a minute here. There we go. Derek, how are
you?
Hey,
I'm great. It's great to be here. I stuck around for the last session. I now have a new book to read, which is tremendous. Frankly, I put some slides together, but I really just should have asked you for the Breakthrough One slides. Either that, or I should have maybe worked Breakthrough One into some of the stuff that I'm going to talk about. But it's great that we're here. I kind of pulled a couple things from the last talk, and ultimately when you invited me in thinking about what to talk about, much of my career has been in startup companies. A lot of it has been as an ecosystem builder in and around New York City. So I really settled on, host, if you could enable screen sharing, that'd be great. But I settled on what I call the power of networks. And effectively, what I wanted to talk about is how networks have basically been, used to build ecosystems. And I want to leave it a little bit on how networks are actually really important for building new ventures in healthcare, and how they can help with your new venture. So terrific. We are now ready to screen share. Thank you so much. We're going to go here. Do that. Where do we go? Bear with me, everybody. Great. And we are going to, where is, all right, can we see this here? All right, terrific. So I unuse SlideShare. All right, we're just going to roll with it. I'm sorry if everybody can see the panels below. This is slightly different than my
your full screen looks great.
Full screen, awesome, perfect. Thank you, Peanut Gallery. So I will back up a little bit here. So as Stan mentioned, I'm the Executive Director of Strategic Partnerships within Columbia's Office of Research Initiatives and Development. I want to give a little brief idea of what we do there, because it'll actually help talk about what we're going to think about a little later. What we do is we put together these multidisciplinary forward-looking research programs. We bring together different stakeholders really to help build the future of places like artificial intelligence, our Streetscapes program, and a number of things in healthcare. Primarily right now, I'm looking at two things that are going to hopefully impact women's health and diabetes. So before we really get to that, though, what I want to talk about is the fact that there is actually some academic backing in how small groups of people can impact and basically build an ecosystem. I'm going to transport you back to San Diego in the 1980s, when there was a biotech company called Hypertech that was acquired by Eli Lilly for $300 million. It doesn't sound like a lot now, but it was a lot then. So there's actually a great paper by a gentleman named Steve Casper about how technology clusters emerge and become sustainable. And effectively, what Steve looked at is the impact of that merger on the San Diego biotech ecosystem. And a wonderful thing happened after Hypertech got bought. Everybody that worked there hated working at Eli Lilly and went to work for startup companies. And effectively what happened, I'm not going to go into what all of this data actually means, but what they showed is that at the companies that were built and growing into the San Diego ecosystem, the leadership of those companies over the course of 1980, 1987, 1984 to 1990 were inextricably tied to the leadership at Hypertech. They were very, very effective at helping start new companies, helping grow the ecosystem to the point where when it spread out in 1995, they weren't the center anymore, but they were really the core that helped drive it for a decade. And why is this important? So I'm going to wind back to New York City in 2007 and 2008. I had gotten here in 2006. And at the time, I was part of a convening organization that was holding these focus groups on how can we make New York a better biotech cluster? Why doesn't New York produce biotech companies the way that San Diego, San Francisco, and Boston do? And invariably, we heard three things. The first thing was that we needed more lab space, which is absolutely true. There was no dedicated lab space that you could just go and figure out where to plunk your company. It was all catch as catch can. You had to basically build it yourself. It was a mess. It was a wasteland. The second thing was we need more capital. So technically, we didn't need more capital. We basically had all the capital in the world. We had the public markets. We had hedge funds. The capital we didn't have was dedicated capital to early stage biotech company funding, right? We didn't have the capital that would come in and start a biotech company, and we needed more of that. And the last thing for the ecosystem was, hey, all the VCs and the entrepreneurs in Boston and San Francisco go to the same bars. They were picking on what basically was the fundamental social underpinnings of the environment. And this was very, very true. I had spent basically the last 2 years while I was at this organization going to every single biotech networking event under the sun. And invariably, they didn't reach the people that were doing the deals. They didn't reach the people that were starting the companies. And it wasn't really reflective of the community. And we had conferences that would come in, but they weren't terribly well connected. There was nothing that actually contiguously brought the community together in a way that brought all of the stakeholders in the community together. Now, I had been in Boston for 7 years, and I had a really great model to pull from. There was something called Biotech Tuesdays that was started by Peter Kolchinsky and Seth Taylor, where they very innovatively invited all their friends in biotech to a bar on a Tuesday and turned it into really one of the largest networking organizations that I've seen. It's still around to this day. So with that, I basically devised this plan to say, hey, what we need is this, continuous, repeated networking event that pulls all of the stakeholders of New York City biotech together every single month for a purely social endeavor. These people need to meet people. They need to talk about their ideas. They need to do it out from under the constraints of a PowerPoint presentation. And I got some really helpful feedback from the folks at the convening organization in terms of building this. They said things like, this is a terrible idea. You just want to get people together in bars, and how would you ever pay for this? They basically said, this is terrible. This is never going to work. So when faced with criticism like that, I did what many people do, is I ignored it and I built it myself. I went to some friends of mine that could actually reach into different corners of the ecosystem and built something where we did get together in bars every single month for the better part of a decade, until this pesky little pandemic came along and started to get in the way of something like that. But it grew from an audience of a couple hundred people in the beginning to 5,000 people by the time that we got to about 2020. And I'm going to really hope this works. So please bear with me while I turn off this sound. The important thing, so I'm stealing this video here from One World Trade Center. And effectively what you're looking at is the growth of Lower Manhattan over the course of decades. And this is really an allegory for everything that happened between 2008 and 2020 on the New York biotech ecosystem. It wasn't just me that was building things socially. We had new funds come in. We had people build incubators. We had the Alexandria Center go up to actually house people with lab space. We had a whole group of people that really were making significant strides in terms of how the ecosystem was formed, where we were going to go. And by the end of it, by the time we actually got to the proverbial 102nd floor that we're going to get to at the end of this animation, we were in a place that was much different than it was in 2008. Now, instead of just having academic labs, I've tried on this slide to put together things that didn't exist, whether they were, Versant, Insight, Medical Excellence Capital, A16Z, 2 Sigma, all of these venture funds. None of them were terribly active in New York at that time. Some of them didn't even exist. We now had J Labs and Alexandria and the Cure and Biolabs. We had incubators. We had new companies like Prevail and Calliope. The actual ecosystem had changed, become very, very different. And now New York City is a destination for biotech companies. Now we actually are really leveraging the diversity of academic institutions, entrepreneurs, companies, patients. I want to make sure I include patients in all this because it's a huge, huge, huge advantage of New York. So I am probably not in the best position time-wise here, but we're going to do the best that we can. So ultimately, I want to wrap up with a couple of thoughts on why does this matter, right? The older amongst you may recognize the gentleman on the left is Kevin Bacon. So we think about 6 degrees of Kevin Bacon. Why does your personal network matter? Well, the first thing is we're in healthcare, and healthcare is a mess, right? We work in an industry where we are going to have to convince a whole host of diverse groups of people about the value of what we're doing. And there are very few people that can do that by themselves. Your network and your ability to reach different people and different groups is really going to be your ability to communicate, your best asset in communicating where the value is in what you're doing. You're never going to be successful operating in only one corner of this quadrant. You're never going to be successful in one niche thing. You really have to include every stakeholder that you can in order to get your value to patients' work and make a difference. And I want to give credit to the DIA Global Annual Meeting folks here for putting together a great graphic to convey just how crazy the future of healthcare is. Secondly, this is a more personal note, but at times during your journey in building your network and building whatever your venture you're going to build, you're going to need people to give you their honest perspective. You're going to need people that want to tell you what they think. You're going to need people that want to tell you what they've been through. And sometimes those people are going to be differently aligned than you. And sometimes all those people aren't going to agree with you. But that does get you away from people who are just excited about what you're building, which is really the empty carbs of the entrepreneurial ecosystem. And it is something that can genuinely help you shape your vision for where you want it to be. And finally, networking isn't really something you do on a Tuesday. Networking is something that you cultivate. Networking is something that you do over time, and networking is something that you grow. So Stan, thanks so much for giving me the opportunity to do this. Again, I'm Derek Brand. I'm at Columbia. I'm the Executive Director of Strategic Partnerships, and I really hope I didn't push over our time too badly here.
Not at all, and just a tremendous and a very important presentation. I think, especially at a meeting like this that happens monthly, not in a bar, but we do have those as well. So no, I think
I'll bring drinks to the next one.
Exactly. No, we'll have to catch up there too. But that's a phenomenal presentation. I think that's why everyone is here. That's why you have hundreds of people attending this monthly, and they are absolutely gravitating, as you can see from all the emojis they're sending you, toward this idea that connection leads to innovation. So thank you for that, Derek, and looking forward to having you on many more shows in the future. Take care.
Appreciate the opportunity, Stan. Thank you.
So again, a wonderful presentation from Derek Brand, bringing in some wonderful illustrations and case studies of how this power of connection helps accelerate innovation. And with that, we are going to go to our monthly show that's put on by Zina Manji, who is, again, a global fellow at HITLAB and a digital health expert galore. She is amazing. She understands the regulatory issues in digital health better than anyone that we know. And she's going to be interviewing Angela Radcliffe from Bristol Myers Squibb. Looking forward to hearing from this. Zina, thank you for joining us today, and handing the microphone over to you.
Thank you so much, Stan. Appreciate the intro. Indeed, I'm a global fellow at HITLAB, and I'm also head of regulatory affairs at Illum, which is a digital diagnostic company. And this is our digital health focused monthly segment. I believe this is episode 10, actually. And so really excited to celebrate this 10th episode with Angela. Angela Radcliffe brings a tremendous amount of experience and breadth of experience in value-based care in intersecting areas, clinical research, as well as on both sides of patient engagement, and as a advocate and transformation advocate for value-based care and clinical research and digital health. So Angela, welcome to this segment. I'd really been excited to join this discussion with you. And if you could tell our audience a little bit about yourself.
Sure. Thanks, Sina. It's so nice to see you and Stan and Jerry, the whole crew here. It's really hard to follow a Ted Lasso image, but I'll do my best. For those who don't know my story, back in 2001, my career had largely been focused in the payer space and the commercial side of pharma. I worked for Cardinal Health and United Healthcare and a couple of boutique med ed firms. And then in 2001, one of my younger siblings was serving as a chaplain in the US Army over in Korea. And he was 21 years old, and he got out of a pool and he died. No sign or symptom, healthiest of all 6 of us kids. And after that happened, thanks to a very kind physician in the military, our family was connected to a clinical research trial that found the gene for long QT, which is a heart arrhythmia, in our family. And that clinical research trial went on to save many, many lives in our family. We're probably up over 100 at this point, because if you know you have the gene, there are things you can do to prevent sudden death. So I found that to be an incredibly transformational opportunity. And I said, well, I'm doing the wrong thing. And I picked up the phone and I started calling people in the network. And that's why this network is so important to us. And I landed myself a job in patient recruitment for clinical trials. And I really had to sort of start from scratch and work my way up. But as I went through the work, I, of course, over time, like many of you, realized the power that digital and data actually has in making a difference for clinical research and getting people to participate and understand, and that the websites and brochures and ads that we were doing just weren't having the impact I was looking for. So, since that time, I've really focused and dedicated my career to trying to find that intersection between digital health and data and that human aspect, that empathy, that place that we all have as patients, even while we're going about and doing our day-to-day jobs.
really amazing, Angela. And I think you really bring forward the human aspect of why we collect data and why it's so important to look towards value-based care, because of course that does bring the benefit, and you need that data to bring that benefit forward. And so in your experience with evidence-based clinical research and kind of shaping practices and interventions, how do you see this coming into play with value-based care systems?
Yeah, it's a great question. You know, there's a movement started, I have to say at least 10 years ago, because we all have to add pandemic time. So maybe it was 15 years ago at this point, that a lot of you have heard of probably, which is clinical research as a care option. Jennifer Byrne was one of the pioneers of that. You know, people like her, people like Craig Lipset, Irfan Khan. We have a lot of amazing people sort of out there doing the work of clinical research as a care option. And of course, what that means is, if you are going to go on Google to buy a pair of shoes, you can put in, I need a pair of blue shoes, size 7, I want a low heel, I want it this color blue, and you get all of these options back to you. But if you are a patient, especially a patient who has limited access to all of the different arms of our healthcare system, maybe you grew up like me and you only had access to community health clinics in rural settings, you don't go type in, I have a migraine, and suddenly options like Excedrin plus, a prescription Midrin plus change this aspect of your diet plus these 2 clinical research studies that are on migraine, and maybe you should participate. And there's a lot of reasons I think that it took a long time for people to recognize clinical research as a care option. And there's still a lot of detractors for the concept, because there are people who still say, well, this is experimental. We, promise people that we're going to help them and improve outcomes with clinical research. But in fact, a lot of research has shown us that patient outcomes improve exponentially when patients are exposed to clinical research participation, and not necessarily for the condition that they're being cared for. In many cases, their outcomes improve because they're being seen by a more holistic, robust health team that gives them a higher level of attention and service than they might have normally through their other care channels. So to me, it's a real travesty that we haven't really made this a reality, but it's also not a surprise, because our system is built with incentives that don't make clinical research as a care option work very easily. And the business of a regulated clinical trial and conducting that as care versus the type of care that you get in a traditional care setting, it's not the same. But it's a huge opportunity for us to improve diversity in clinical trials. It's a huge opportunity for us to have a better economic outcome. So I think we need to be looking harder at finding a way to make it a reality in more places and ways.
Yeah, it's amazing. I think you're really bringing forward also the cultural aspect of how we consider, like you say, the clinical care option, but also being open to clinical trials and participating it in different ways. But even as organizations, so from an organizational perspective, and obviously you're not going to drive the benefit broadly enough, especially when we're looking at more represented populations. So how do you think organizations can better ensure that we have broad representation?
Well, some of the things that are starting to help, right, is that we are starting to look at more care settings as a place to bring value to patients where they already are. So look, we all have seen some of the failures and missteps. Those are the first attempts in learning, the people who've been brave enough to go out there and try different things. But places like Walgreens, places like Walmart, they both have interesting programs that are helping to promote value-based care. Walmart does some really interesting things with their employees, with second opinions on conditions, and they have some great research they've put out about that, as well as interesting work that they've done with the VA. And then you look at a company like Walgreens, who has not given up the good fight of bringing clinical research into the communities. What it comes down to, though, is it really does come back to trust. And trust is that secret magic ingredient for everything. And it's twice as important, 10 times as important in healthcare, and maybe 20 times as important in clinical research with the background that we have with communities of color. And it comes back to being willing to build something called effective trust. And I can't claim credit for that. Two very brilliant people at a company called Acclinate have gone and shared that concept about building effective trust within communities. And what that really starts with is listening to people for their lived experience, and then meeting people where they are, where they want to be met, and doing it in such a way that respects their autonomy. And that includes with their data, with their medical data. It includes with giving them the opportunity to say, hey, I don't want you coming into my home. I know you think that's easier for me. I want to go somewhere else. It means, hey, this might be the first time as an elderly person, I get out this weekend. I want to go see somebody. I want to go interface with people for my care. So building effective trust matters for every community. And that only starts with meeting people and having empathy for their lived experience instead of us saying, here's the system, live with it.
Yeah, I think a really important note about that is meeting patients where they are, but also where they want to be. And that lived experience even comes with the condition that they're suffering from. So it also brings into question or consideration about real world evidence. It's looking at the clinical trial, but also in the clinical trial setting, but also within that clinical trial, understanding that real world aspect of what the subject is living with on a day-to-day basis, and getting even more insight on how that data can be applied. So when you look at data and the digital health tools aspects, predictive analysis as well, analytics, machine learning, and how that gets integrated into value-based care to identify at-risk populations. And of course, these tools can bring about how you tailor the interventions and also the real world evidence aspect we were just talking about. So what are your thoughts on that?
Yeah, I appreciate that question so much. First of all, let's just pretend we're in a magic world where we have now built adult relationships with patients one-to-one, where we are not taking data from multiple sources, unconsented, combining it, and expecting this to be the way that we build a longitudinal health record for a patient. So let's pretend we're in this beautiful trust-based data world. If that's true, then the potential of digital health to impact a patient's lives and to improve value-based care is so exponential. Part of that is we have hit a tipping point where value-based care can be enabled by digital health solutions. But that also means we have to come back to taking the long game. We have built so many useless companion apps that we call digital health. There are things that we could be doing to improve data literacy and health literacy that are critical. And so there's this great opportunity now, and people have created smart ports that tell us when a patient is getting an infection before they're sick. So if we have this potential at our fingertips, if we could respect that by pairing it with giving patients the data and the digital and the health literacy they deserve, we'd really be onto something amazing.
Another important point, I think, really considering not just the digital tools, but what outcome are you trying to drive from the technology as well, and how that integrates into the care system you talked about earlier. A really important point that can also actually feed into the choices of what digital tools you do end up using in the trial, because you're focusing on what outcomes are you trying to drive. So when you're looking at all these different data sources, electronic health records, wearables, remote patient monitoring, patient-reported data as well, integrating that data can be quite challenging. And so what do you think are the specific challenges that arise when you're trying to integrate that data and creating a more holistic view on value-based care?
Yeah, that is a tricky question. I'll put my former head of enterprise data governance hat on and just say that we really have to start taking some of the core fundamentals of data management more seriously. We need to truly be thinking about fair data. So is our data findable? Is it interoperable? Is it reusable? But in order for all of those things to be true, it starts all the way back with consent and trust, number one. Number two, we've got to stop the proliferation of platforms that only solve one small piece of the puzzle. We really need to continue to lead with solutions that are interoperable with one another. The burden that we put on our healthcare professionals around technology is incredibly significant. And now we've hit this point where we have the amazing evolution of AI that most of us, we've seen coming in life sciences for a long time. Computational research has been a thing for a long time, but I think now, we're in this sort of brave new world. And I think what people don't recognize is, and I had a chat with a really brilliant Stanford professor earlier this week, and he sort of said, we have this opportunity to sort of start building from scratch. Like, we don't have to take all this dirty data and speed it into our algorithms and make the algorithms as dirty as our data. We actually can look at the potential of what we could build, and we could take something, we could build something clean, we could make it interoperable, we could do it from scratch, and we could go from there. And so we do have a unique opportunity, I think, to abandon some of the ways that we did data management in the past and start to think about it in a whole new way so that we don't repeat the mistakes or create unintended consequences as we try to integrate all of the data that's up on us.
Yeah, amazing point, Angela. I think you're really bringing forward why perpetuate complexities. Let's kind of simplify down to the core information, the core outcomes we're looking for. So as a wrap up, Angela, what would you say? You've seen both sides of the system, both as a clinical researcher, advocate, but as well as on the patient side, and seeing the value of the importance of value-based care, even in your own personal situation. What would be your kind of call to action to overcome barriers and on driving value-based care?
Yeah, so it might be a slightly controversial tip, but my call to action is participate in a trial yourself. Many of us sit in a place where we are responsible for creating the tools, the technology, the data strategies, the solutions, or giving care. And we are far enough removed from the day-to-day experience that we forget. I'm on trial number 9 in my life. And I believe deeply that clinical research has the power to impact all the social causes we care about. So I believe that if you participate in a trial that, even as a controlled, placebo-controlled, non-interventional trial for mental health, you could stop homelessness, because a lot of our unhoused people are grappling with mental illness or substance abuse. So I think the exponential potential we have, let's see how many times I can use exponential today, but clearly I'm passionate about this, to impact beyond even healthcare into the things that really matter to us. It starts with participating. And then when you do, you have experiences like I have, which is you sit and you're with your study coordinator at your visit, and they ask you to go through and rewrite the way you wrote the date in your consent form, 15 minutes out of your visit, because you wrote, in the global format instead of the US format. And the fact that that's what we're still taking our study coordinators' time with, right? Or I'm not getting the e-diary notifications. Maybe those actually don't work. And when a patient says it doesn't mean they're not being compliant with the app that we gave them. So participate. It gives you your own perspective. It gives you that opportunity to have that lived experience and to share it with others. And I think empathy is the number one thing we can bring to our jobs. It is so much more valuable than convening a patient panel to get feedback on your protocol or your solution. So that's my answer. Participate, everybody.
Incredible, Angela. Thank you so much. A great call to action. And you got to be in it to win it, so to speak. But also focus on that outcome if you want to actually drive value. Really focus on the value itself. Thank you so much. Back to you, Stan.
It's fantastic, Zena, and just a wonderful session, and can't agree more that empathy really does drive these processes. And In terms of processes, no one is using more in healthcare than Salesforce, given its absolute overall prevalence in healthcare institutions today. Salesforce is everywhere, whether it's a hospital, a health plan, or a life science company, driving processes. And next up is, again, HITLAB's own Ainsley Bowen to talk to a tremendous HITLAB ally, Angela Radcliffe, who is a huge sponsor and just evangelist of all the work going on at the lab in terms of evidence generation around digital health products. Rachel, thanks for joining us, and Ainsley, handing it over to you.
Hi, everyone, and thank you, Rachel, for joining us today. So Rachel George is the Global Lead in Health System Advisory and Innovation at Salesforce. I've had the privilege of speaking with you one-on-one in the past, and I'd like for you to give an introduction to our audience here today.
Yeah, absolutely. Thank you so much, Ainsley, and thank you to the HITLAB for having me here. I am an internal medicine physician by background. I still practice clinically, very intermittently, very rarely, and really because I went into medicine because I love taking care of patients. But my full-time job is in healthcare administration, and I've spent a lot of time over the last 20 years leading healthcare provider organizations. And over the last few years, I really looked at what's happening in healthcare technology and thought, that's where change is driving and moving so fast. And so let me really jump into what's happening in healthcare technology. And I've been with Salesforce, as Stan mentioned, for the last couple of years. Super excited to be here. So thank you.
Yeah, and again, thank you so much for taking your time out of your busy schedule. And on that topic of technology and healthcare and value-based care. So, as you mentioned, technology has been a driving force in healthcare transformation. So how do you see that technology and those advancements contributing to the implementation and the success of value-based care models?
Yeah, so remember that value-based care is basically doing two things simultaneously, right? It's providing incredibly high quality care while decreasing costs at the same time. And this can seem like an oxymoron, but that's because we've historically been focused on illness care instead of wellness care or prevention of illness care. And if we can truly make that shift from illness to wellness care, then improving quality while decreasing costs can just go hand in hand. And you can add just general prevention of illness in this category. And I think about what Angela just spoke about in the beginning of her presentation and her family story, where they were able to identify individuals with long QT syndrome. And think about how much morbidity and mortality were decreased just because we were proactive in identifying it and treating it before issues arose. And that's really the essence of value-based care. But in order to do this successfully, you really have to have a really full understanding of all of your data. And gosh, we don't have a lack of data in healthcare. We have data coming out of our eyeballs. However, we do have a lack of usable data. So advanced data analytics is critical. You have to be able to gather it, process it, analyze vast amounts of patients' data to identify patterns, predict outcomes, optimize treatment plans. And this is really one area where predictive AI becomes immensely useful. And as AI becomes better and increasingly more common, our ability to be successful in value-based care increases and becomes better and stronger.
Yes, so as you mentioned, that value-based care heavily relies on data-driven insights for decision-making. So from your perspective, how can healthcare providers and systems better manage that overwhelming volume of data generated by various different sources in order to be able to drive more meaningful and actionable insights?
Yeah, and it's really not about having the data because we have the data. It's about having the metadata, right? The data about the data in a way that's easily accessible and kind of put in front of you in a way that you can understand. So what are the trends, not only for populations, which we talk about a lot, but for individuals? Is an individual's weight and fasting blood sugar slowly increasing in a way that no single value is setting off any alarms, but enough to be concerned that if the trend continues, the patient will be looking at a new diagnosis? So one of the challenges that we're having today is that there's so many sources of data. We have EMRs, in many cases, multiple I am personally in 4 different EMRs, so multiple EMRs for a single patient. We have, RPMs and the many wearables that exist today, but we also have information about social determinants of health, including like where a person lives and whether they live in a food desert or not. And so in order to be successful in value-based care, we have to have all of that data, and we have to look at it through a single pane of glass that is easily accessible to anyone who needs it without having to log into multiple databases or systems, and without having to do swivel chairing like we all talk about it in data management.
So it seems like what you're kind of touching on is that data overload almost. It seems like that can be a challenge. And do you know of any strategies or tools that healthcare professionals can use to almost filter or actually prioritize the more actionable insights from the abundance of available data?
Yeah, no, this is really where I see the opportunity of AI in healthcare taking hold first. There are really some very interesting clinical challenges that AI can help solve for, which, as a clinician, I get very excited about. For example, diagnosing rare diseases, which often go underdiagnosed because they are by definition rare and know what a clinician thinks of or may understand. And while that's super interesting, I think the real opportunity of AI initially is managing the data and supporting things like value-based care. And in order to be successful, organizations need to make sure they have a really robust data strategy. Does your data talk to each other? One of the challenges and opportunities that we have right now is that there are so many healthcare organizations that are popping up everywhere, and so many data organizations, and there's so much happening, and they're all collecting different forms of data. But it doesn't matter unless the data talks to each other. Do you have a platform that can accept all types of data from different sources, including and not limited to multiple EMRs, RPMs, and other types of data like geodata or the research data that we were just talking about, that we can create what we call a customer 360 or patient 360, which is a full view of the patient. And once you have that data in a structured format, then you can expose it to an AI engine that can evaluate that data for you in order to create actionable insights that can be presented to your team proactively to ensure that the data doesn't just sit there, but is actually acted upon. And it's not reliant on an individual to go and find that trend or to find that issue or to figure it out on their own, but it's presented to them, and then it's just a matter of acting on it.
I love that. That's super important and innovative to think about how AI can potentially change this value-based care in the data world. And in terms of an actual example, have you seen the innovation of AI being used to successfully tackle these challenges? Or do you think this is more something in the future?
Yeah, so two things. Absolutely, the answer is it is happening now. It is happening in a lot of industries. It's not happening well enough in healthcare, in my personal opinion. And a lot of that has to do with, data not being able to talk to each other. This group and this network, which I love. I love this community that we've been able to build together. But I think we need to commit to making sure that we create and provide data that is interoperable, because regardless of our own need to advance our own organization, which is totally important. I mean, I understand that. We are, though, working in a healthcare environment, and we have to be willing and able to share our data and create things that are interoperable. And I think that's really important. And so that lack of interoperability right now is one of the biggest things that's hindering us. But I think that there is a ton of innovation happening to create platforms that are bringing it all together, and not only at Salesforce, but at other organizations. I mean, I don't want this to be a Salesforce message, because I think this is really a message for all healthcare organizations about how do you bring data together on a single platform. A lot of room to go in healthcare, but if you look at what Disney's doing. For goodness sakes, if you have a kid between the ages of 5 and 12, Disney knows everything about you, right? They have every piece of information about you and every member of your household. And if an organization like Disney can do that, we certainly need to do that. We need to do that even better in healthcare.
No, that's I love that analogy there, especially related to how we can use that in an AI and just hopefully be able to tailor, those tools better for better data utilization and interoperability. And just as like a wrap up question here, the success of value-based care relies on accurate data, but there are discrepancies and inconsistencies within that. So do you think technology or even AI as well can help ensure data accuracy and integrity, most importantly, to help drive reliable outcomes?
Yeah, absolutely. I'm so glad we got to this question because I think it's so incredibly important. So hopefully everyone has heard of some of the challenges of what are called LLMs or large language models like ChatGPT, specifically around hallucinations. And if you're not aware, generative AI models that work on LLMs essentially try to create the next best word by looking at the entire world of information available on the internet. So if you're not aware of this already, let me be really clear and then say that there's no guarantee that the information that ChatGPT spits out, and I love ChatGPT, don't get me wrong, but there's no guarantee that that is accurate. And hallucination specifically refers to outright wrong information that can sometimes be generated. For example, made up trials, made up legal precedents. So in healthcare, we need to ensure that the data that these AI systems are learning on are based on accurate information and backed by real science and not pseudoscience. And we also have the real issue that a lot of historic knowledge in healthcare is really biased. For example, many systems still use different calculations for GFR, which is a measure of kidney function based on race. And what that does is it actually makes it harder for African Americans in the US to qualify for the transplant list. And I think that a majority of clinicians understand that this is completely faulty. However, I will tell you that one of the EMRs that I work in still gives me two different GFR numbers based on race. So it's still prevalent, very much prevalent today. And so this race-based faulty information permeates our healthcare information. So as we expand the use of AI in healthcare, how do we ensure that these biases aren't propagated, that they're actually mitigated? And so to answer your question, AI in healthcare needs to be trained on information that's accurate and needs to go beyond just LLMs to truly ensure that recommendations are accurate. And I think this is the opportunity that we all have as AI is growing in healthcare, as we're really looking at about what this integration actually means. How are we ensuring that we are really creating a solution that is, highly equitable, that is accurate, and so that it's learning on information that is true and not just on the entire wealth of information, because we all know just because it's on the internet doesn't make it true. Like, let's talk about the many things that are there. So how do we train AI in a way that makes sense? And I think this is why, human intervention and what we all do today is going to really impact what's going to happen in the future.
That's amazing. Thank you so much for sharing those insights on that. Something I haven't even thought about is when we're building the AI, the whole database and everything that needs to be based on accurate and reliable information, or else the data and all the tools that AI can provide don't offer us anything at the end of the day. So thank you so much, Rachel, for your time. Again, it's always great to speak with you. And I will pass it back to Stan.
Thank you.
That's fantastic. Thank you, Rachel. Thank you, Ainsley. And just a wonderful interview and a great conversation about what's happening here in the ecosystem and how things are changing and coming about in a very interesting and in some situations rapid, in some situations not less so. But don't forget the Innovator Summit happening here at Columbia University on November 28, 29, and 30th, the week after Thanksgiving. Looking forward to seeing you all there. You can join here with your QR code. We are on hour number 3 on the agenda, and we are excited to bring to you a terrific conversation between, again, HITLAB's own Jerry Antimano and AstraZeneca's own Soren Patel. And with that, though, just a quick note, we just had a nice post come across from a tremendous ecosystem partner, Information Media Corporation. And so I'm going to pop in the LinkedIn post that they just posted on there, showing some of their data. We've done a lot of evidence gathering on their platform. They're a smart packaging company. So take a look at them, take a look at what they're doing, like their post, respond to it. Joanne posted it from Information Media Corporation. And again, it's a clinical trials, smart packaging platform that can help save not just a lot of lives during clinical trials, but also afterwards in terms of clinical trials efficacy and making sure that products are safer once they go from thousands of patients in a phase 3B to millions of patients into the general market. With that, though, handing it over to Jerry Antamano. Jerry.
Yeah, cheers, Dan. Thanks so much. Glad to be back on, and a pleasure to have Soren Patel join us for this part of the program. It's my honor to be able to interview you, Soren. AstraZeneca, of course, is no stranger to the vast majority of the audience, but I'm sure they'd love to know a little bit more about what you do and a bit more about your background, and I think in particular the precision program that you're currently leading at the minute.
Brilliant. Thanks, Jerry. And yeah, thanks to everyone at the HITLAB team for having me today. Really excited. And yeah, so myself, I've had a slightly interesting journey. So similar to Rachel, I'm a medical doctor by background. I was trained in the UK and then was specialising in colorectal surgery, mostly in high volume cancer centres around London, but then also in New York at an East Coast paediatric trauma centre. So had fantastic experience working in that environment, operationally quite literally. But my interest was always wandering towards how patients were actually getting to operating theatres, tables, sort of that level of specialist care. And it was very evident that sort of when you were getting sort of treated earlier diagnosis, as we all know, often that impacts your outcomes. So when we're talking here about value-based care, that's sort of, I guess, where my journey started, because I got very much involved in quality improvement programs, looking at standards of care, and that took me on a journey sort of alongside my clinical practice, working in sort of key partnerships, basically centered on enhanced referral pathways from everywhere from Vietnam, South Africa to then involved in some large cancer centres in the UK. In increasingly, life sciences, pharmaceuticals are now coming into that space because ultimately you can innovate and produce medicines, but actually if we're not improving the way access and equity in care and the outcomes, then there's a real sort of like mismatch in that space. So this is then sort of my current landing point at AstraZeneca. So I work in the respiratory department, and on a really neat program called Precision Program, we're really championing practice change. So for want of a better description, it's very much healthcare transformation and real partnerships with health systems across the globe. Obviously in my domain, it's respiratory, but across different conditions, how we can actually accelerate that access to medicines, treatments, generate efficiencies and pathways, and real partnerships with sort of every piece of the patient journey.
No, that's awesome. Thanks for giving us some insight to the great work you're doing right now with AstraZeneca in that particular program. We've had a lot of speakers on today who are talking around about sort of costs and funding and stuff like that. With your experience, of course, with your background as a physician, I'm sure the audience would love to know about the tools and tech that healthcare providers are adopting at the minute, to sort of alleviate certain pressures around sort of trying to improve the quality of care, and how they're using that tech and those tools to ensure that patients are receiving that level care without incurring like such huge costs at the minute.
No, absolutely. Yeah. It's a really interesting space and involvement that we've come through, where there's so much of a focus on cost, both from where I mentioned like every step of the pathway, right from patients through to healthcare professionals accessing it, and then health systems can't get away from it ultimately. So where there's a vast opportunity to leverage technologies, I think that one of the previous speakers, I think Angela said, there are so many different technologies though. So where you're looking at that point of care, sort of focus on that area. And it can be really overwhelming as anyone sort of operating, whether it be healthcare professionals or also from the patient side, who is actually making the decision here, because we're moving away from that kind of like sort of a traditional previous practice that people are used to, and sort of been there through the evolution where sort of when I was taught at medical school, it was like, oh, do we even bring out phones, or is it acceptable to look at a computer during a consultation? Whereas obviously that's now massively shifted in a really short space of time. And that can really sort of like affect around a sort of patient relationship. Then you've got that cost element brought into it as well. So I think from a technology perspective, we've got to be be really respectful and find that sweet spot about ensuring that healthcare professional patient relationship is really kept as a sanctuary and that trust is built in. And then obviously, because on both sides, the cost part is relevant, and where we're looking at value-based care, things are also we're coming back to outcomes. So I think that warrants time and explanation. So until we get more comfortable with that is all part of someone's holistic care, that sometimes decisions are being made at that certain point for like longer term outcomes. That's how we can sort of feed it in. But I think the delivery of the technology, let's put aside like what the technology is, but how we're actually using that in those interactions, whether it be remote, in person, etc. I think that's how we can really sort of bring patients along that journey, bring also healthcare professionals along in that space where we're moving at lightning speed, quite rightly so, given these massive features that are against us. And that's a part we want to hit that sweet spot.
No, I think that's great. I think I think you really put it well with sort of taking the sort of the synergistic and holistic approach. In that sense. To sort of like change track a little bit here in terms of looking at now, from your perspective, like how existing like inequalities within healthcare, like disparities in access to care and socioeconomic differences and things like that, how is that impacting the implementation and the effectiveness of the value-based care models that you're seeing?
This is something I'm really passionate about, because there's accessing the highest quality care, and saw something really interesting, because if it was all about that, then healthcare systems would be very straightforward and easy, right? You push out an amazing technology, the cutting edge, whatever it is, and it get adopted. Whereas actually, when we're talking amongst peers and clinicians, I think one of the analogies we often bring it back to is in those emergency scenarios, and a lot of people have very basic first aid training, so hopefully this resonates. It's always instilled to you, look for the quiet patient, someone who, there will be people that shout the loudest and it will be crying out for help, but actually it's the person that's quiet that might have the most need, is most in danger. And often think about that when we have disparities in care and think about our value-based models. It's that patient that actually can carry the biggest disease burden in future. That could be the person that carries the most significant cost, and ultimately can actually sort of reshape your whole, or like in terms of redistribution, actually there needs to be a big and very concerted, conscious effort to consider those patients wherever they might be, and foreign populations. So when we're looking at, and in current practice, my current field, we're looking at how different sort of populations can access that. I mean, I mentioned before where I've worked in sort of very remote parts of Vietnam, where deliveries of healthcare provisions come every sort of third day. How can those people make sure that they get sort of the care that they need, and also to get it early critically, because where, as mentioned at the beginning, that's often part of this model. So that, again, I think we need to get comfortable with the way that principles of value-based care models might mean a redistribution in getting to the areas of greatest need. But how can we actually do that? I mean, in terms of standards, we know that in some conditions they exist, in others that they don't. In some hospitals that they do, in others that they don't. Shared learning is super important, but how we need to continue on this journey. We need to quickly get there, but also I'm a big champion of how we can sort of share those standards and best practices, and not necessarily just keeping them in centers of excellence and such.
Yeah, I love that. I think with your background of having that experience in the UK as well as in the US, I'd like to sort of wrap up the conversation here because I know we're at time, and these sessions go so quickly. And I'm sure you've got so many more insights, but just to sort of close up this conversation, we'd love to hear about some of the key factors that contribute to the divergent pop health, like you were talking about, in terms of the outcomes between the UK and the US, and how these two different countries' healthcare systems and their different policies sort of play a role in shaping the those sort of differences.
Yeah, so massively privileged to have worked in both. What I would say from a policy perspective, both countries are really trying to adopt that universal coverage. So from where the WHO says universal coverage, they're doing it, but in very different ways. And when I was working in the US, that was when the Affordable Care Act was just being implemented. So sort of very unique sense where, for example, that hadn't necessarily landed. I think one of my key takeaways was healthcare professionals, anyone working in the healthcare space, needs to have an input, needs to sort of have the and need to consider how they're actually going to adopt some of these practices in person. Because, for example, I think most people could say if you walk into an emergency department and see a right arrow for one type of health insurance plan versus a left arrow for another, that's quite jarring and quite sort of different. So you can actually see just even at the front door at a point of care access how healthcare outcomes might start diversifying from that in the first instance. And I think both, US, UK, different models. I'm not here to say one's better or the other, but and I would say mine's a pediatric experience. I think there's a lot we can learn from the way we care for children, and actually sort of looking at sets of symptoms. I think Angela earlier touched on this as well, looking at sort of ecosystems, sets of patients and conditions, rather than looking at interventions and things at isolation. And that brings it back to technology as well, where we can gear things to those sorts of aspects. I mean, in terms of those two countries, I think we need to look at sort of areas. There's a big focus on bringing innovation and high costs that are associated with that as a limitation, but there's a huge opportunity for moving away from looking at those low value activities and redistributing that to high value add. And I think actually where healthcare technology could play a huge part in both of those healthcare systems to be able to make room for those innovations if we start doing that better.
Yeah, and I totally agree with you, Sorum. Thanks so much for your coming on. We really appreciate you're busy, and you're over in the UK right now, I think. So, appreciate you coming on in the later part of the day. So many more insights I'm sure you could share, but great really being able to hear you touch upon the processes, the tech and the tools, as well as the different policies and stuff that are in place, that are trying to make this, impact in value-based care. But thanks so much for coming on. Everybody in the audience, please do connect with Sorum. Her information is in the chat. And Sorum, have a great rest of your evening.
Pleasure. Thanks for having me. Bye-bye.
Thanks. Stan, back to you.
No, I appreciate that, Jerry. Wonderful conversation with Jerry and Sorum. Again, really addressing some of the challenges that we're seeing in digital health technology adoption. And again, more of this is available to you all. Just click on the QR code in the lower right-hand side, and you'll find yourself going into this ecosystem a lot more and getting a lot more of these insights and these connections into healthcare and digital health. And so next up, we are really excited to bring to you another leader from a life science company, Theo Borgeman from, again, a tremendous company that's doing a lot on the cutting edge of what's going on within GSK. Theo, how are you and where are you?
Hi, doing well. Thanks very much. I'm currently in Massachusetts, so not far.
All right, outstanding. And again, let the audience know. Let's start off with a little bit about your background, about your journey and where you come from.
Sure. I was trained as a heme-oncologist and finished training not too long ago, about 2 years ago, but have always had a passion for the research side and, of course, for the digital tech field. And after training, I do still see patients in the clinical setting, but I've also bridged over to industry. So I also serve as a medical director for a big pharmaceutical company in the lung cancer space.
That's super impressive. And talk a little bit about value-based care, which is again the theme for today's symposium, and how it's affecting the clinic, and from your perspective and where you're sitting.
Right. In the clinic, we, of course, we look for tech that helps us lower costs, lessen the time needed for patients, and all those things hopefully will translate to better outcomes. I can speak about the things that have failed in the clinic. So I think, unfortunately, that's sometimes the best way to figure out what works. So I think the technology really needs to be targeted to the patient population, number one. A lot of the oncology population, octogenarians, are older, and for reasonable reasons, they don't know how to use technology. This also applies to the clinical side. Older physicians don't know how to set up some of this technology. So ease of use is really important. It should ideally be a one-click thing and allow for remote access if something goes wrong. So I think that's the biggest step, is the software has to work and has to be easy to use. Allowing for real-time readings is also very important. We have a lot of metrics that come through on our side that are cross-section. So they give you a value at a section in time. We really need to be able to go back into the patient's day, perhaps the week, and look to see where those numbers have been earlier on. So that's really important for the data and software to allow us to look at readings in real time and across a span of time as well. And the third is, and perhaps I think something that others will agree on here, because I've heard it harped on a lot, is integration into legacy systems. This is really important. I think it was a big theme at the Investigator Summit last year as well. Technology that talks to EMRs and standard medical software is absolutely crucial. We don't want a technology that sits apart from those, because that just means we have to look at a completely different data set, and it adds additional work to try and put the whole picture together. So ideally, everything that can talk to each other is the goal. And the last one is accuracy. Of course, things have to be accurate, have to have quality inspection that's done already by the time it gets to the bedside. And I think the most common thing in this space is just natural language processing. A lot of the language processing we use to dictate our notes are just don't work well. So I think accuracy is the last thing I'll add there. Yep. So that's it from the clinic side, Stan.
No, that's a lot. Yeah, and I think people are really trying to put get their brains around the value-based care system, and where they're going to lock into it and how they're going to be successful in it. It's not something that's intuitive. It does take a little bit more thoughtfulness to understand. And along those lines, what kind of medical applications may benefit from this, from what you're seeing, and how is that going to work out?
Yeah, I think there's plenty. I'll just quickly dive into that question by introducing the same idea of having helpful, valuable, reliable digital tech enter the clinical trial world. So we think about how we can adapt these same ideas into running clinical trials, and modalities like that and software like that and applications like that are really important, especially to me, for somebody that tries to straddle the clinical and big pharma world. So I think if we can develop software that helps us along each stage of the clinical trial path, it'll absolutely be amazing. And you think about how this software can help with recruitment, with monitoring, with the analysis of the data. It's something that was probably not pioneered, but essentially really accelerated during the COVID pandemic. I think because things needed to be done quickly within the COVID time, they used a lot of this AI technology to really help streamline a lot of these trials. So when it comes to location, we want to pick locations where the eligible patients will be the highest. Oftentimes this means making predictions months in advance before the trial starts. And so we can use AI to create, what I like to call these predictive futures to help generate where we think the disease will be most prevalent and where we should target our focus. And ultimately in the clinical trial space, that translates to less screen fails and faster recruitment. Another area in recruitment I think that is really difficult is allowing for more patients to be eligible for the trial. So if you think about all the other clinical applications I spoke about in regards to AI being used in the clinic, if we can adapt that to a recruitment standpoint, we can allow for patients that live in remote settings that can't afford to get to hospitals to come onto trials. And ultimately, I think that's important in health equality and in the diversity message that I think we're all pretty passionate about. In the monitoring standpoint, so after a trial begins, a lot of the work is done to monitor safety events and to clean the data. I think if we have digital tech and AI helping the medical monitors keep tally on, a large number of patients, it would be a great application for this as the trial progresses. And then, of course, in the end, you think about analysis. AI has already come into this space to an extent, but we use, I've used not in the big pharma world, but in the lab space, I've used AI to help me do regression analyses at the end of acquiring data and to help me see trends, to help me look at subpopulations. And then the last thing I'll mention is the radiology world. And I think we've heard a lot about digital tech being used and AI being used to help make diagnoses. For trials that are dependent on our overall response, we want to be absolutely certain that the data that comes in is accurate and true. And so AI can help us there too. So no specific example, but a huge example of how AI can come out of the clinic, enter the clinical trial space within the same value judgment and help us along every step of the clinical trial modality.
Yeah, that sounds really impressive. And it sounds like you guys are being very thoughtful about what you're doing. And obviously along that thoughtfulness, there's also got to be some recognition of limitations relative to implementing these sorts of technologies in value-based care and even implementing value-based care itself. Talk a little bit about some of the limitations to implementing value-based care.
Sure. Yeah, plenty of hurdles. The technology, number one, is the technology really has to translate to important endpoints. For example, at-home monitoring systems, I'll think of a patient with like congestive heart failure, for instance. The patient and the technology not only has to show that the patient feels better, but what the hospital and the regulatory agencies want to know is, does the technology lead to less admissions in the hospital, less readmissions when compared to standard of care? And I think this is where HITLAB is important and what all this innovation is important for. It keeps the innovation going, and ultimately we hope to compare it to standard of care with real world outcomes. So such tech has really not been subject to randomized clinical trials, probably for a lot of reasons, but this is important, I think, ultimately in its validity. And once that is done, and once we prove that it's true and equal or better to standard of care, perhaps that may help with reimbursement too. So I think that's a huge thing to think about in the end, is not only prove it works, but hopefully hopefully that'll incite insurance companies to increase reimbursement for such technology. And the second thing I'll tell you is maybe more of on a personal level, is that we shouldn't pitch this technology as replacing anybody. I don't think the local radiologist wants to hear that we have a new AI technology so you can go somewhere else. It should really be an adjunct. And that goes back to my other point, which is think about the endpoints that are important and infuse this technology to what's already being done, and it should be an adjunct to what's already in place and make it better.
Any final words you want to impart on the audience as we wrap this up?
Yeah, I would say it's important for clinicians to always chime in when they are dealing with a new technology in the digital space, because you don't really understand the limitations of an application until you start to use it and you start to adapt it into your own daily life and to see how it meets your demands. So I think it's important to stay vocal and participate in forums such as this so that there can be a crosstalk between the clinical world and the tech world. I think those worlds need to be married for this to function.
Fantastic. Theo, thank you so much for joining. Again, a loud round of virtual applause with emojis and all those good things from our audience around the world. And looking forward to seeing you again soon, Theo. Thank you very much.
Thanks so much.
Just incredible work that they're doing at GSK. And again, Theo coming in with that expertise as a physician is really someone who understands the clinic situation as well as anyone. So we have a couple more sessions to wind down our symposium for this August version. And coming up next is, again, HITLAB's Ainsley Bowen to talk to Sydney Cooper, a UX UI research designer and with a major health plan in the United States. And so, again, looking forward to hearing about this next session, as we all know that it all starts and ends with design. So Ainsley, handing it over to you.
Thank you, Stan, and thank you, Sydney, for joining us today. Glad to have you on our program, and I'd like to start with just introducing yourself to the audience.
Yeah, thank you for having me. I'm a UX researcher and designer, a healthcare blogger, a public health and wellness advocate. I've also worked in several healthcare sectors, from literally starting as a patient service coordinator, checking patients into the Epic EHR for their appointments, all the way to working with innovative health tech companies on their user experience.
That's a great way to start us off with this session and to kind of get into the nitty gritties of the topic with the health technology and the impact on healthcare access and equity, as I know you're passionate about. How has the introduction of health technologies impacted the overall accessibility of healthcare services, especially in underserved or even remote areas?
So obviously, from an optimistic perspective, health technology has created pathways for people that didn't previously exist. Not only has it connected people to healthcare professionals, but it's also connected people to health information. And even sessions like this, you can find resources, communities, chat groups, essentially, for just about any health concern or condition that you have today. And I think that increase in the connection to community is in itself an increase in accessibility.
And can you elaborate more and provide some examples on the specific health technologies that you have seen successfully address disparities in access to care, and how do those technologies work?
Yeah, so one company that I cannot say enough great things about is Health in Her Hue. They empower Black women and women of color to advocate for themselves in healthcare settings while also connecting them with culturally sensitive medical providers through their platform, which I think is awesome. I think it's overdue, quite frankly, but it's an incredible organization. And I think they've even, as far as accessibility, they've even provided about 200 memberships to residents of underserved communities within Minnesota, as an example. And even the community conversations that I've had the opportunity to moderate provide virtual access to healthcare resources, topics, and providers.
Oh, well, that's great that there is starting to finally be, more availability and technologies and resources to help really be able to address, the disparities, especially in the rural areas and underserved areas. So that's a great example that you provided. And, on the topic of still trying to provide more, health with technology to these areas, there is challenges that arise as barriers with the adoption of health technology, particularly in relation to health equity in healthcare. Can you kind of talk about what you think are the most important or biggest challenges that we have to overcome?
Yeah, so the number one thing that always comes up for me is cost. As an example, wearables are extremely convenient, but unfortunately, they aren't always equitable in the sense that they're not necessarily always affordable. And a lot of these wearable technologies that could be supporting the people that most need them in these underserved communities or those that are disproportionately impacted by health disparities aren't necessarily covered by insurance. So even if you do have insurance, you're not always going to have the affordable or the affordability or that accessibility that you would need to even utilize these types of technologies. And that's simply because the American payment model just isn't there yet. Hopefully we see changes and improvements with that, but I also did want to talk about how a lot of these big health tech companies target the masses. And that makes sense. But at the same time, we also know that it's no secret that traditional healthcare was not necessarily designed for people of color. It's incredibly biased, and people of color are much more impacted by these health disparities than any other group of people. Using a very basic example, something like BMI. If a health technology or a wearable is built to assess BMI and then make care management recommendations, the people that are developing these technologies and those recommendations need to be aware that the information that sometimes gets used to inform those recommendations can be inherently biased or racist. That's something that I think about every day when I'm working in research and design. You want to make sure that you're always designing for the consumer and always using information to inform technology that is designed for that consumer.
No, I love that. Definitely, we need to focus to be more inclusive and consider everyone when developing anything within the healthcare space. And kind of turning the conversation a little bit to, I wanted to get your opinion on telemedicine and especially remote monitoring. Do you think that these have improved or worsened disparities in terms of access? And do you also think that there have been certain populations that are unfortunately disproportionately affected?
Yeah, so I'm going to give the answer that most people hate. It depends. So I think affordability is one aspect, which I touched on, but also consumer trust is a huge risk to telemedicine's availability and ability to expand access. So in terms of trust, some of the user research that I've done related to consumer opinions on things like virtual health reflect that there is still some level of mistrust in the physician's ability to assess, diagnose, and then treat them virtually, in addition to what's actually being used with their health data, which I think some of the other speakers have touched on previously.
Yeah.
So although we're passionate, we being those that are working in health tech, and knowledgeable about telemedicine's potentials, the people that we serve aren't necessarily as knowledgeable or as trusting. So I think education is definitely part of increasing some of that accessibility and adoptability, but also messaging and communication around the potentials of those technologies and then what we're doing with consumer data.
And do you have any recommendations for being able to spread that education? Do you think that there is more collaborations that we need between healthcare providers and community organizations so that they can, number one, spread the education and awareness, but also effectively address the different healthcare disparities that exist?
100%. I think partnership with community organizations, especially organizations that are already trusted organizations within the communities that we're targeting, are extremely important. If we're working in silos like healthcare traditionally does, I think that kind of prevents us from progressing as much as we could.
And have you seen any successful collaborations that has addressed these issues?
Yeah, so I think honestly, healthcare insurers are doing a much better job at tapping into the communities that they serve. A lot of these health insurance providers operate on a state-to-state basis. So I've seen efforts to kind of go into the community and be more like patient or consumer facing and not just that payer on the back end, which I think is really important.
And I wanted to get your thoughts on this as we kind of wrap up this session just a little bit in terms of data privacy concerns. So how can data privacy concerns impact equitable use of health technology? I'm kind of going back a little bit to that trust factor. And what steps do you think can be taken to balance the privacy with improved access to care?
Yeah, so I mean, obviously not using predatory practices and taking advantage of users. I think it's especially important in health technology not to do that because these are vulnerable people. This isn't necessarily like social media, which is still, we shouldn't be using consumer data inappropriately, but something like health, I think once that trust is broken with our consumers, it's really hard to get it back. Also, people are at their most vulnerable. So I think just becoming a trusted source as far as data privacy and then communicating with our consumers how and why we're using the data that we're collecting is extremely important.
Definitely. And just to add one last quick question here to wrap this up, in terms of the use of social media, I know that others like yourself are promoting healthcare and awareness online through social media, and it can be a very useful and impactful tool. But do you think there are also concerns with social media, and where do you find that balance?
For sure. I think social media, the good in it is that we have a lot more access to people with information. But at the same time, there are people that are not necessarily experts spreading misinformation, and misinformation in healthcare. Not only is it becoming a bigger concern, but it's also, I think it kind of pulls us back from a lot of the progress that we've made in healthcare and in the spread of information and access to information. So just being a trusted source, but also making sure that people are aware of the sources that they're following. I think that's extremely important. Now anyone can be an expert just jumping on social media and talking about it. There's good and bad in that, but yeah, just making sure that you're following people that are credible and that have like are pulling the information that they're sharing from credible resources.
Right. No, thank you so much, Sydney, for sharing all your valuable insights, especially with that social media portion, because, you know, there is definitely a fine line there and where to balance it. And especially with the public health background, we are always taught, make sure you trust your sources and make sure it's a trustable and reputable source before you ever take any of that medical information. So thank you so much for joining us again today and taking time out of your busy schedule. And with that, I will hand it back to Stan.
Thanks for having me.
That's phenomenal. Thank you, Sydney, and thank you, Ainsley, for a wonderful interview. And again, I think it's important as we're building this ecosystem, as we're building the next generation of digital health tech. It's going to be important to remember to tune into the Women's Health Tech Wednesdays. They were from 12:30 to 1 o'clock every Wednesday afternoon, Eastern Daylight Time. It's a great time to catch up with the world's top leaders in women's health tech and venture. Click on the QR code in the lower right-hand side and register today, and it'll be great to see you online next week. And we are in the last session of this amazing August Digital Health Symposium. And again, some of the folks who have had just an incredible run in collecting data, in pushing digital health to new levels of efficacy are our good friends from Sana and Richard Hanbury, the CEO and the founder of Sana. And Richard, thank you for joining us today.
Hi, Stan. Thank you for having me. It's been a great pleasure, and I've enjoyed listening to all the speakers this morning.
Yeah, it's a really great program, and I think, you know, again, for the audience that doesn't know about you and your company, maybe start off with a couple of minutes about your journey and your company.
The very short version is 1992. I had to drive a Jeep off a bridge in the Yemen in order to avoid a head-on collision with a petrol truck. 60 foot down, that caused a spinal cord injury, T8, T10, so I'm a wheelchair user still now, TBI, PTSD, but the biggest problem was a nerve damage pain problem that gave me an overall 5-year life expectancy. I was borderline pediatrics, because I was 19, where you have a high rate of opioid resistance. And so none of the opioids worked at all, but obviously opioids are an appallingly bad long-term pain solution for chronic pain. It's kind of the same story across many of the pharmaceuticals when you're talking about pain or long-term chronic diseases. And so I realized during that whole process in hospital that when they tried to teach me meditation, it was a dumb idea, because meditation gives you more present moment awareness. And if your present moment is hell, really stupid to put you back there. Opioids are designed to lower your consciousness, which is why they lower pain. But then I watched a movie. The movie flipped me in and out of what we would now call a flow state. That changed my pain levels more than morphine. And then I was like, okay, so if I had meditated all my life, I would be able to access these states at will. And that would give me a better painkiller. So I started looking at different kinds of stimulation, ended up with audio visual stimulation. This is the current version of the device. So back then it was laptops, wires and boxes, and it was my university dorm room. We put the device on, you're getting pulses of light and pulses of sound that are then generating very specific frequency patterns in the brain. That then wiped out all of my nerve damage pain over the course of about 3 months. And that was 30 years ago. That started the 30-year mission to where we are now. Wearable tech really started taking off from my perspective, 2015, 2016, 2017, and we're almost now able to make what I want to make. We still have a problem in the wearable space that most of the available sensors are optimized at a firmware and design level for battery consumption, which means they're not done for signal quality. So some of the people you've seen with wearables are like us. They've had to design or redevelop their own sensors to get data that's good enough to use.
Right.
So currently, this version of the device, we restarted the company in 2016, started then going through the FDA, process. We have a de novo for fibromyalgia in front of the FDA right now, and new data on neuropathic pain, and as of this morning, really good data on PTSD.
That's fantastic. Let's cut straight to the slides, because that's, I think, what everyone wants to see is about your data that just came out, and just the number of FDA studies that you're doing is so impressive. So why don't you share the slides, and I'll jump off camera and you just present for the next 5 or 10 minutes.
Great. Does that work?
It does. That looks good.
Fantastic. Yeah. So to start with the problem. This is a survey we did at Pain Week, which is the most important innovation for active clinicians. There's also American Association of Pain Medicine. Hang on, sorry. Why is that not working? And yeah, we did a survey of how good do you consider current available treatments, and how interested would you be in an alternative? We gave people 4 reasons for why they were looking for an alternative, and all of the above. And of course, the all of the above category got the vast majority of those votes in this 142-person pain doctor survey. So people are looking for alternatives. Now, this has led to, I mean, it's the same in pain, opioid use disorder. And one of the very, very big problems has been who's going to pay for it. So pair therapeutics is a really good example of a technology that was kind of basically there, but couldn't figure out the who's paying for it part. Now, luckily for us, CMS produced their proposal in June that all breakthrough designated devices would have coding and coverage within 6 months of FDA approval. So we're in front of the FDA now for fibromyalgia, and I'll come on to the neuropathic pain in a second. But this is the device. This is the representation of it. Pulse, light, and sound changing patterns in the brain in the same way that other people are trying to change it with electrical impulses or magnetics. Obviously, the drug process and the drugs that are available, everyone knows about the side effects and the problems of most of the drugs that are being used in the neuro and pain space. They are the best that's currently available until folks like us come along. In neuropathic pain, though, this is our latest data. This is as of about 3 weeks ago. This is a pivotal that was done at Mount Sinai with Dr. David Petrino. The gold standard in pain studies is that you're trying to get your 30% of largest responders getting more than 30% improvement, and we're at 90% improvement on our top 30% within neuropathic burning pain. And this is 20 million people with neuropathic pain overall, and 10 million people with burning pain. This was a sham controlled. It's really difficult in the device space, producing a viable sham that then doesn't have an active effect. The way the FDA analyzes this data at the moment is very much with a drug bias. So they're trying to remove any placebo effect, because you can't get people to take a sugar pill ethically and then get the clinical benefit of that placebo effect. In devices, that's not true. In devices, if we could get someone to actually use a sleep mask every night, they would get a benefit from that. But you can't get them to do that. You have to have something more engaging, more active. So that's one of the biggest challenges in the device space in this area. So that's on neuropathic pain data. This is just one of the ones from to illustrate again the problems of the drugs in space. Lyrica is the biggest selling drug in both fibromyalgia and neuropathic pain. Roughly 80% of people stop taking it by the 6-month mark, and then obviously by 2 years, you've literally only got 10% of people who are prescribed it still taking it, and you're talking about lifelong conditions here. And us with a device, we've got 80% of users still using at 2 years. We get all of our dropout pretty much in the first month or two. We've got a PTSD study ongoing, which is DoD funded. Our dropout rate on that study is 20%, just less than 20%. The average on PTSD studies overall is 50%. And at the moment, we're getting 300% better improvement than on treatment as usual alone. So that's kind of the summary of where we are now. We produced a very large amount of data. The Mount Sinai pivotal is the crowning achievement of all of it. Really clear-cut device versus sham, where we showed long-term actual changes and improvements in the brain. So I'm going to stop the slideshow now and go back to the speakers. And I apologize, I've got someone calling me, spamming me, which I can't stop because I'm on my computer and it's on my phone.
That's okay. That's the part of this virtual world we live in. So, I think the audience, I'm just getting messages on LinkedIn and then also on the chat board here. And again, we have a few more minutes here, but we'd love to get questions from the audience as well. In terms of your biggest concerns around barriers for the adoption of these revolutionary technologies, I mean, the data was amazing. You have much better adoption. You have much better long-term usage because people are less concerned about, molecules hitting their pancreas, liver, kidney, side effects, things like this. So what are the barriers that you're seeing right now with the adoption of these sorts of technologies?
It's who's paying for it. It's what everyone has struggled with, which is why the CMS ruling in June was so important for us, because that solves it with the breakthrough device designation. 50% of the pain market is Medicare and Medicaid. Another chunk is the VA. So for startups like us, the biggest problem is always funding. And the thing that then continues on funding is, okay, well, how are you not going to be have the same issues as pair therapeutics? In the neuro device space, everyone so far who hasn't been on breakthrough designation or hasn't yet had the benefit of what CMS has just proposed have solved that by going to the VA. So the VA has had much better access to this new tech. Hopefully now the CMS ruling will fix that for Medicare and Medicaid. And for startups like us, we don't need the whole market. We need that starting point, and then it gives us time to figure out all the private insurers probably going the Medicare Advantage route first and then crossing over into employer-based healthcare. So,
yeah, that's exactly right. Well, just tremendous data, Richard. Congratulations. We know how much work you put into this and just what an incredible journey you've been on, and very, very impressed with the data that's coming out right now. And oh, wait, we do have one more question. In terms of PTSD, one person's asking whether or not this is something that can be used for PTSD.
Yes, so our PTSD study at the moment is DoD funded. It's a pilot. The DoD has just agreed the 3 million follow-on pivotal, and at the moment, the pilot is device plus treatment as usual versus treatment as usual on its own, and we're getting a 300% greater increase in improvement over treatment as usual currently. So very definitely aiming for the VA as a primary outlet for PTSD.
That's brilliant. No, I'd like to talk to you about that offline. There's a 4-arm study that we did at Columbia about 10 years ago that was amazing in terms of different populations, device plus drug versus device versus drug versus whatever. So anyway, just tremendous.
Yeah, I mean, one of the biggest problems in the one of the biggest bottlenecks in the whole of American healthcare is the number of specialist providers in mental health care. So which is why the DoD pushed us on to, well, can you help people on the waiting list while we're trying to figure out how to get them to this greater specialist care. And it's basically, theme across everything that we're doing is where do we fit into the toolkit? Because things like cognitive behavioral therapy on apps, there's a lot of really good work being done, but doing neuromodulation before someone does that, then the two combined, we should massively be able to outperform most of the current treatments on most things in pain and mental health. This mixture of neuromodulation plus cognitive behavioral therapy, derivative apps plus VR, the whole digital ecosystem together will be providing massively better alternatives for many of the drug treatments that are currently the standard of care.
Well done, Richard. Thank you for joining us today, and we'll talk to you soon. Take care.
Fantastic. Cheers, Ed.
So what a great story, considering everything that's going on in digital therapeutics, everybody. It's wonderful to see Richard come on, just a tremendous CEO, managing his company through everything and seeing such great data, all the phenomenal studies that he's done. And just congratulations to Richard on all of that. Now we've got about 30 seconds to wrap up. The production team is telling me, so we're going to go through some more announcements quickly here, but don't forget to sign up, use your QR code BT1 and Summit 25 for your 25% off for Breakthrough One memberships and for the Fall Registration Summit in November 28, 29, and 30. And again, as we go through the last few slides here, we're going to wrap up at 2 p.m. We're really happy that you all joined us today, and we can't thank the team enough. Jerry and Ainsley, don't forget to sign up for the Breakthrough Alliance and the Symposium in the end of September 28th, 11 a.m. to 2 p.m. Click on the QR code there to register. And don't forget, if you want to sponsor any HITLAB events or any HITLAB studies or anything like that, hit the QR code there. And we are really thankful for you all joining. Have a great rest of your last day of August, and we'll talk to you in September. Take care, everybody.